chickadees. Time for the afternoon session. Here we are, all back. I hope you had a lovely lunch. I made myself a bologna and cheese sandwich. No fast food for me today. The Mr. Demeanor is away working today. He's not working from home, so that's why I was unable to get lunch in. But I have a full belly now, and I feel fantastic. And I'm feeling a little salty about this witness we were just watching before we went to the lunch break. Welcome back, Boston Wild, and also Melissa Simak. And you had a ham sandwich. Was that in honor of the Karen Reed trial? Come on, you can be honest with me. Is that what you were doing, Boston? You were just trying to get a little smooth action in there. I get it. Okay. Yes, that's exactly what it was. Great. I love it. Okay, so we left off with Tom Connery. He is one of the victims. He was stabbed 3 times. It appears in the buttock region, thigh, leg area. And he was being cross-examined by Mr. Kevin Smith. Sadly, I don't even know what the prosecutors' names are. That's how unremarkable they are to me. I feel that they're leaving a lot of things on the table when it comes to testimony. I feel like they should be trying to hit some of this stuff off at the pass, and they're not. So I think this will be good fodder for the retrial. And I am anxious to watch that. But for today, we are going to go right back into the testimony. So let's get back to the cross-examination that was still pending when we made our lunch break, which was ironically when the court was breaking for lunch as well. So
we'll stand in recess from now until 2 p.m. We'll pick evidence back up at 2 p.m. All right, thank you so much. Attorney Smith, you may proceed.
Thank you. Okay, Mr. Connery, I can reorient myself to where we were. I think you had just told us that a Shelton High School kid threw a punch, but you can't recall who that person was, right?
Correct.
How far away were you from where the person threw the punch?
I was at the mulch pile, so 5 to 10 feet.
5 to 10 feet away.
Yeah, that's about that.
You couldn't tell who it was that threw the punch?
No.
But you could tell that it was a Shelton High kid?
Yes, it was from someone's back. Like their backside was towards me.
And you said that when you ran over to where Ryan Hines and Raul Valle were fighting, that they were just tussling, right?
Yeah, they were fighting.
No full punches were going on.
I don't recall the specifics, but they were fighting.
And they were fighting on the ground, right?
I don't think so.
And you said at some point you took Mr. Hines's place after you pushed them apart, right?
Correct.
And that you made eye contact with Mr. Valle, right?
Correct.
And in fact, when you described that to Officer Bango on July 9th, you told him that he stared into your soul and made creepy, demonic eye contact with you, correct?
Yes.
what?
Demonic eye contact?
It was eye contact of someone who knew what they were going to do. It looked
Shut
very
up.
unpleasant and very scary.
And then you said at some point the fight just stopped, right?
What?
Yeah.
Do we see the fight just stop on that video?
No, it keeps going.
So this end of the fight where it just stopped, that occurred sometime after the end of the video, right?
When I refer to the fight just stopped, that's referring to when me and Raul have separated.
Okay. So after you and Mr. Valle separated, the fight continued, right?
Yes.
And who did you see involved in the fight at that point?
I don't recall seeing what happened after that point.
Did you see Faison Teal?
No, I did not.
Did you see Matthew Lokovich?
No, I did not.
Did you see Alex Bernson?
No, I did not.
Did you see Tanner Chernowski?
No, I did not.
Did you hear Tanner Chernowski?
No, I did not.
I'm going to ask you to watch what is labeled as State's Exhibit 60. And if we can see the 25% with the frame numbers on them, please. And I may ask this to be paused at various points, okay?
Okay.
Do you see at frame 330 the person that you've described as Ryan Hines?
Yes.
And is he the person to the left of the screen wearing the green sweatshirt and the black shorts with the white trim?
Yes.
Can you play it again, please? Just from where we are. Did you see rain falling through the course of that video?
Yes.
Yeah.
Do you recall it being misty and rainy that evening?
Yes, I do.
Do we have the ability to go to certain frame numbers on there? Yeah. Okay. Can you take us to frame, just start at the beginning at frame 0? This is the very beginning of this video, correct?
Correct.
And in this video, I'm going to point that on this screen.
Okay.
Your screen. Do you see the green sweatshirt, black shorts with white trim here to the right-hand side of the screen?
Yes.
Do you see beside that a pair of lighter colored shorts with a dark shirt on top?
I'm sorry. I can't see where you're pointing.
I'm sorry, this is the right of the person you described as Ryan Hines.
Yes, I can see that.
You can see that on your screen as well?
Yes.
Is that you?
No.
You were wearing a dark top and light shorts that day?
Yes.
And who is that?
That's not me.
How do you know that's not you?
Looks like there's a logo on the back of the shirt.
Can we go to frame 10, please? And I'm going to point here on this screen again. Do you see the green top, black shorts with white trim that you've identified previously as being Mr. Hines?
Yes, I do.
And do you see beside him the dark top with graphic on the back and the white shorts?
Yes.
Do you see beside that another person apparently wearing light shorts and the dark top?
Yes.
Is that you?
Not that I recall now.
You recall telling us that you were close to Mr. Hines, correct?
Yes, but before the video was when I had my interaction with him.
Before this video is when you had the interaction.
Yes.
And can we go to frame 14? We're gonna have a little trouble zooming, getting to that pinpoint. Okay, that's fine. Let's go with 16 there. Oh, okay. And do you see in frame 14, again, green top, black shorts with white trim over to the right-hand side of the
Yes.
frame?
Yes.
And you now see two people with lighter shorts and dark tops, one of which has a graphic on the back.
I see they both have graphics on the back.
When you say they both have graphics on the back, the farthest one to the right, you believe that's a graphic as opposed to that person's head.
Yes, it looks like a graphic to me.
What color shoes were you wearing that evening?
White.
Would you agree that these two people both appear to be wearing white shoes?
No.
No.
That looks like black.
What?
Through to frame 29. Would you pay particular attention to frames 25 and 29?
Okay.
See the counter on the bottom?
Yes, I can.
Do you see from frame, here we are at 22, is there a way to make it progress frame by frame?
No.
Do you see now, okay, here we go. Let's stop there. Did you see those two people kicking their legs?
No.
Is there a way to, does that have a little speed on it? Slow it down, really focusing on 25 and 29. Can we go back then to frame 79? That's fine, yes, thank you. Perfect. Now, can you see this on your screen as well?
Oh, yes, I can.
And do you see sort of center left, again, Mr. Hines, green top, black shorts, and white trim?
Oh, yes, I see that.
Do you see this person with dark pants, a white top, and some sort of multicolored graphic on the back?
I can't see where you're pointing, sir.
To the right of Mr. Hines, sir.
Oh, you're talking about the looks like long black pants, like the closest person?
I think so, yes.
Can you point again? Because actually, I'm sorry, you're blocking my vision.
Do you
There's
have
no
the-
way for me to do
excuse
so.
Do you have a pointer here?
Yeah.
Could you use that?
Thank you so
Thank you so much.
Do you see this person right
Yes.
here with the dark pants and the white top and the multicolored graphic on the back?
Yes, I do.
Do you know who that is?
I cannot tell now.
And where were you while this frame is being seen?
I believe I'm in the far back.
In the far back.
So-
When you say in the far back, behind this group of people?
Yes, behind that. Yes.
And you see Mr. Hines here,
Correct.
and you believe at this point you'd already been stabbed.
Correct.
You believe Mr. Hines has already been stabbed.
Correct.
Can we play forward to 112? You see a person on the ground here, Mr. Connery?
Yes, I do see that.
Do you believe that to be Tyler DeSilva?
I can't tell in this.
Well, you described him before as wearing a blue baseball style jersey, correct?
Yes.
And can we play it to 135? Here we are at frame 135. You see the gentleman with the white shirt, multicolored graphic on the back, and the dark pants to the right.
Yes.
You see beside him a person with a dark shirt, light shorts, and some light shoes.
Yes, I do.
You see beside him another person, dark shirt, light shorts, white shoes.
Yes.
Would you agree that this person that we've just described in the dark shirt, light shorts, and white shoes is going to the left of the screen towards this altercation happening to the left?
Yes, it looks like that.
Would you agree that these other folks we described, these two on the right-hand side, they are participating in something that's going on to the right side of this room?
Yes, they look like they're looking that way.
And do you see on the far left what we've already identified before as being Enrico Fiola holding a camera?
Yes.
And can we play that ahead to frame 182, please? This is frame 182. Would you agree that's the still shot that we've seen earlier when you were showing the exhibit? Would you agree?
Yeah, it looks similar to it. Yes.
Right, because we see Enrico Fiola here again, right? He's looking towards the screen. You can see the light in his eyes.
Yes.
And he's again holding the camera, correct?
Correct.
And there's, again, this person on the ground, which I believe earlier you identified as being Tyler DeSilva.
Yes, that's him.
And that's Tyler DeSilva on the ground, correct?
Correct.
And then can we play it forward? I'm sorry, can you back that up to maybe 180? Do you see here, again, Mr. Hines with the black shorts, the white trim, and the green top?
Yes, I see him.
What is he doing there?
Standing over the kid on the ground.
Can we play that forward to 183? Sir, would you agree that he is kicking that person that is on the ground? Doing something, but you're not sure what.
Yeah, it's hard to tell.
Yeah, hard to tell with that leg.
All right. Can we play that forward? And I'll just ask you when to stop her. Thank you. Can you stop? Do you know who this gentleman is that's standing here in the front of the frame with the white shirt and looks like some sort of dark bottom?
It's hard to tell with the light on his face.
Can we play that forward just a little bit more? And again. Stop, please. Any idea who that was?
It looks like someone named Alex Zaborek.
I'm sorry?
Alex Zaborek.
Alex Zaborek.
Yes.
Do you remember
New
him being
name.
there that evening?
Yes.
Did you tell anybody about Alex Zaborek being there that evening?
No one's asked me about him.
No one's asked you about it. Can you play that forward again?
Sir.
Can you pause it there? We're at frame 332. Do you see that, Mr. Connery?
Yes, I do.
And do you see here to the left, standing beside somebody with their camera out, Ryan Hines with the white trim, black shorts, green top?
Yes, I see him.
Do you see Mr. DeSilva on the ground with his baseball jersey up over his head, hockey style?
Yes, I see that.
Do you see Alex Burnson leaning over him?
Yes, I see that.
Do you see Michael Sampieri also coming towards him?
Yes.
Is this your brother coming into the frame here from the right-hand side?
Yes, it looks like it.
Can we play that again? Forward ahead. And can you pause that? And do you see your brother being followed by this gentleman in the gray top with the dark shorts?
Yes.
Who did you tell us that was before?
Joey Romano.
Joey Romano. Did you tell anybody that Joey Romano was there that evening?
None.
You weren't asked.
No, and no, I was not asked.
Do you see this gentleman here with his shirt off and the dark colored, maybe camouflage shorts?
Yes.
That's Matthew Lokovich.
Correct.
And he's in a group, you would agree, with Mr. Romano and your brother.
Correct.
Can we play that forward again, please? Can you pause it, please? Do you see right behind Mr. Lokovich a person with white shorts and a dark top?
Yes, I do.
you believe that to be Mr. McGrath?
Yes.
Can you play that forward again, please? And you see Mr. Hines standing to the left of frame 400, correct?
Correct.
Green top, black shorts, white trim, correct?
Correct.
Jacob Villalobos shoving Mr. De Silva, correct?
Correct.
You see the leg and part of the body of Mr. McGrath, correct?
Correct.
And he's standing in close proximity to this group that is shoving Mr. De Silva away. You agree?
Yes, somewhat close.
Can we play that forward, please? Can we pause it there, please? We're at frame 490 now. Can you see that?
Uh-oh, I
Yes.
see what he's getting
Where were
at.
you located when that was going on?
In the back area where I was saying before.
I don't think
Behind the crowd.
so.
Still
I
behind
don't
the
think
crowd,
so.
correct? Are you laying down at this point?
No, I was not.
What were you watching at this point?
I was just in shock and just staring off.
Do y'all see what I'm
You still
seeing?
see Mr. McGrath here in frame 490, correct?
Correct.
Where were the rest of those people that were just with Mr. McGrath?
There to the left of him.
You could see them?
No, but just from the last clip before.
You're inferring that they didn't just disappear.
No, they did not disappear.
Now, is your testimony that, at least when you saw Mr. Hines engage with Mr. Valle, that they were just tussling and there was no punches, correct?
They were tussling. I didn't see punches or anything else.
Did you see Mr. Hines kick anybody?
No, I did not see him a kick.
You didn't see him punch anybody?
I didn't see punches.
Did you see him tackle anybody?
It wasn't tackling. It was just tussling. I don't know how to exactly describe it, but they were going at each other.
And after you claim to have separated them, did you see Mr. Hines go and do any of the things that we just saw there on the video?
No, I was.
I have to back this up, y'all. I was going to respond in the chat here, but what I noticed, and I'm going to try to get to the spot because maybe my eyes were playing tricks on me, but what I saw is there's a logo on the back here, and this has been identified as Jimmy McGrath. That is the individual, the young man that lost his life. So I want to back this up because I thought you could see the back of the shirt and it did not have a logo on it because I'm not so sure that this is also Jimmy McGrath. I don't know that. I'm not sure.
And you see Mr.
You
Hines
see what I'm
standing
getting
to
at,
the left
y'all?
of frame 400, correct?
Correct.
Green top, black shorts, white trim, correct?
Correct.
Jacob Villalobos shoving Mr. De Silva, correct?
Correct. Correct. Yes,
Can we put that forward, please?
It does. Okay. My bad. My bad. I just had not really paid attention for a logo on the back. And I did just see it right then. I did y'all see it too? Right when he turns, you can see it does have a logo on the back. So that's the same person. I was looking at this going, wait a minute.
more close.
Can we put that forward, please?
And you'll see right there is the logo. So my bad. False alarm.
Can we pause it there, please? We're at frame 490 now. Can you see that?
Yes.
Where were you located when that was going on?
In the back area where I was saying before, behind the crowd.
Still behind the crowd.
Correct.
Are you laying down at this point?
No, I was not.
What were you watching at this point?
I was just in shock and just staring off.
You still see Mr. McGrath here in frame 490, correct?
Correct.
Where were the rest of those people that were just with Mr. McGrath?
There to the left of him.
You could see them?
No, but just from the last clip before.
You're inferring that they didn't just disappear.
No, they did not disappear.
Now, is your testimony that, at least when you saw Mr. Hines engage with Mr. Valle, that they were just tussling and there was no punches, correct?
They were tussling. I didn't see punches or anything else.
Did you see Mr. Hines kick anybody?
No, I did not see him a kick.
You didn't see him punch anybody?
I didn't see punches.
Did you see him tackle anybody?
It wasn't tackling. It was just tussling. I don't know how to exactly describe it, but they were going at each other.
And after you claim to have separated them, did you see Mr. Hines go and do any of the things that we just saw there on the video?
No, I was not looking for that.
You couldn't see any of that.
No, I was not looking for it.
Did you see Faison Teal stomping anybody?
No, I was not looking for him.
Ooh, this
It's
is
your
rough.
claim or your recollection that you were stabbed even before the video started.
Correct.
I don't think
It's your
that's
claim that there were
accurate.
only 3 people involved in the fighting.
From what I saw, and what I was looking at, the angle I was at, yes.
and that most people are just sitting watching.
From my point of view, correct.
You were dressed similarly to Mr. McGrath that evening?
Different color shorts and no logo shirt.
Dark top,
Yes.
no logo on your shirt,
Nope.
white shoes,
Correct.
light gray shorts.
Correct.
All of the kids that were there at that party that night, other than the kids who showed up in the pilot, were very close friends of yours, were they not?
Yeah, they're, I wouldn't say super close. Some were closer than others, but they were friends of mine, yes.
Many of them you had grown up with since childhood, correct?
Correct.
You would get together almost every weekend over at Mr. Rich's house, correct?
Not at his house, but we would get together with everybody every weekend, different places.
Different places, but engage in a similar sort of party wherever those places were, correct?
Not every weekend, but here and there, there'd be something to do.
And when you would get together, there would typically be drinking, you told us.
It depended on the situation.
Come on.
And you wouldn't want to see your friend's reputation or memories be harmed in any way, would you?
No.
After watching that video the way we just watched it, does that change your recollection of anything that you told us?
No. What I remember is what I remember.
Thank you. Nothing further.
Thank you.
Attorney
I
Vincent.
have questions. Hey, Tommy.
How's it going?
Council just asked you about this video.
Correct.
This is frame 252. Do you know who that is by the car?
Yeah, that's Raul Valle.
You didn't see that, right?
No.
At the time?
No.
You know that now?
Yeah, I know it now.
Can you play the video, please? Stop. And frame 287 on the ground, that's Tyler DeSilva, right?
Correct.
But you didn't actually see that at the time of the video, right?
No.
Stop. Now, frame 397, who is this individual starting to push Tyler DeSilva out into the street?
Jacob Vilobis.
Play it, please. Stop. Now, frame 416, who is that stumbling out towards the street?
Towards the street is Tyler Silva.
Who's directly behind him?
Raul Valle.
Do you remember that happening on the night in question?
No.
And who is this individual standing by himself right here on the left side of the frame?
The one with his arm right
Yes.
there. That's Jimmy McGrath.
And was it at this point that you looked over and saw Jimmy McGrath stab?
No, no.
Play, please. No. Who's standing out in the street all by himself in frame 453?
Tyler Silva.
That's not the defendant right there?
No, that's not the defendant.
Play, please. Now, this individual on frame 489, who is this right here? I'm sorry, you're left. Frame 489 on the left side of the frame.
That's Jimmy McGrath.
Standing all by himself?
That's what it looks like.
Did you remember seeing this happen on May 14th of 2022?
I saw him standing by himself, but after they drove away.
Please play. Frame 533. Do you see Mr. McGrath?
Yes, I do.
What does he appear to be doing at this moment?
He's backing up away from something.
Did you see that happen on May 14th?
No, I didn't see that.
Who is next to Mr. McGrath in this frame?
Tyler Silva.
So
Oh, I wanted
you
them to
remember
keep
certain things
going.
happening that night, but not everything that you saw in the video.
Correct.
Is that fair? Safe assessment?
Yes.
So at what point in time do you remember seeing Mr. McGrath after you realized your staff?
So after I realized I was stabbed, they had already driven off, and actually he was standing somewhere near where he is in this video, and that's when I saw him stabbed and fall to the floor.
You saw him lift up
He
his
pulled
shirt?
up his shirt, there's blood, and he just dropped.
Now, counsel asked you a little bit about you giving a statement to the police about the defendant making eye contact with you just prior to him coming towards you and hitting you in the leg, right?
Correct.
Describe why you said what you said.
Because the way he looked me in the eyes, no one's ever looked at me that way before, and it was now when I think about it, the punches that I thought were being punches was someone who looked at me knowing what they were going to do.
So how would you describe withdrawn when he looked at you? Is that the moment that he came towards you?
Yeah, we made eye contact and then we engaged.
So describe how when he made eye contact with you, how he engaged you.
He was on literally bent over as I described before. He looked me up right into the eyes and I looked at him, and then he came right at me with the leg, and that's when he was doing the hooking motion into my leg.
And when he came at you, what was your reaction to that?
I immediately was doing the thing, get off like this.
And when counsel asked you the fight just stopped, what did that mean? The fight just stopped. It didn't just stop.
Me and him had our separation, and that's when I stood there in that back just looking around in shock.
And when you were in shock, were you? What were you doing? Were you focusing on what was happening?
I
around
think
you?
I don't recall exactly what was happening around me because my body was just telling me like, you're hurt, like, figure out yourself. So I was just sitting there, standing.
Were you engaged in who was around you and taking notes on
No,
all your
no.
friends around you?
Not at all.
So when counsel asked you, was Matt Lokovich there, and you said you can't recall, why did you say you couldn't recall?
Because that night I was not thinking, where's Matt Lokovich right now at this moment?
And when he asked you where Mike Samperi was at any particular moment, why weren't you?
I wasn't thinking, where's Michael Samperi?
And how about where your brother was?
I thought I already had pulled my brother out.
Y'all, I just, there's a question that's burning in my brain, and I just want to share it with everyone. Maybe y'all can help me out as we get more views on this video. But who they just pointed out to be Raul, and when Tyler Da Silva was in the street, I thought the camera panned over and Raul was by the car. How did he get that far over? Am I tripping? Straighten me out, please, because it's the second Monday for me. And I already was like imagining stuff in the video earlier. But when they just pointed that out, that was Raul Valle behind Da Silva in the street, and I thought Raul was already over by the car. I'm confused now.
And what about where Jimmy McGrath was?
I wasn't thinking, where's Jimmy McGrath right now?
And how about any of your other friends that have been mentioned?
Not a
during
single
your
person I was
testimony?
thinking about now, not where they are.
So with regards to when counsel asked you about when the car initially drives up and people say someone's out in the front yard or the car's here, and you walk out into the driveway, but you stand at about, I think, 30 feet away. How many people were around you that were from the Shelton party?
Like I said, there was 10 people in the driveway around me,
How
about
many people were close to the car?
another 10.
And at that moment, were you taking notes about who was to the right of you, who was to the left of you?
Not at all.
Why weren't you taking note of that?
Because I was taking note of who were the people that were not supposed to be here in the car.
So where was your main focus at that point in time?
The people in the car.
And with regards to when you go back into the house and then you come back out a second time, remember when you just testified across that the car was down the street, and you
Yeah.
come down to the tree line area?
Correct.
And Boston Wild, that's a problem if that's the truth. If he was over by the car, because this doesn't work what he's saying.
So I think your testimony, this is State's Exhibit 49, testimony you were somewhere down near the second red bush towards the street,
Yeah, correct.
down the street. You remember when counsel asked you about, do you recall Faison Teal was in the yard at that time?
Yes, I remember that.
Do you remember what your response was?
No, I did not see him. I do not recall seeing him.
Why didn't you see Faison there?
I wasn't in the yard. Hey, where's Faison Teal? Thinking that.
But was Faison Teal at Tyler Rich's house?
Yeah, he was at the party, yes.
You just can't recall whether or not he was in the yard at that particular moment?
No, I cannot recall.
Could he have been at the yard?
Sure, he could have been, yes.
Maybe you didn't see him?
I wasn't looking for him.
So with regards to anybody that may have been around you, in addition to Faison Teal, again, was your focus on your friends around you or what was happening down the street?
I was looking down the street. I wasn't thinking who's next to me in this moment.
I need to see that video
With
again.
regards to one final question. Council asked you about this picture. State Exhibit 57. Recall that?
Yes, I do.
Do you know where that picture was taken?
Yes, I do.
Where was that picture taken?
Mr. DeJesus' house?
You didn't take that picture, right?
No,
How do you know that this is Mr. DeJesus' house?
I've been over there before.
Okay, and when you say Mr. DeJesus, who are we talking about?
The father, the person who owns the house.
Do you know if Mr. DeJesus has any children?
Yes, he does.
And who are his children?
He has 3 boys and 1 daughter.
And are you friends with any of his
Yes, I am.
children? Who are you friends with?
Nick DeJesus through my brother, and then Joy DeJesus because he's older than me.
And was any of those individuals at Tyler Rich's house then?
Yeah, Nicky was.
Nikki was?
Yeah.
So when you're referring to Mr. DeJesus, who's 50-something years old, you're talking about the father, not the son.
Yeah, the father.
All right, thank you. I have no further questions.
Thank you.
You were just asked about when you had been out in the driveway, looking across the way. There were 10 of you in the driveway, you recall, and another 10 across the street with the car, correct?
Correct.
And you told us you were just focused on who was in the car that wasn't supposed to be there, correct?
Correct.
And that's why you didn't see anybody rocking that car, correct?
Correct.
That's why you didn't see anybody put their hands on that car, correct?
No, I did not see that.
That's why you didn't see anybody throw anything at that car, correct?
No, I did not see that.
That's why you didn't see any of your friends do anything to that car that night, correct?
No, I
Because
did
you were
not see
just
that.
focused on who was in that car.
Correct. I was hoping who
So
was in it.
focused that from 30 feet away, you could tell us, despite the 10 people being in front of you, that Jack Snyder was the driver and Mr. Valle was a passenger, right?
Yeah, I had a sight on them. I looked at them, and that's what I acknowledged.
Whoops.
Thank you. Nothing further.
When you noticed the defendant and Jack Snyder in the car, did you hang out there the whole time or did you make your way back inside?
No, I went inside.
Okay, so you didn't stay outside the entire time during?
No, there was already so many people out there. I didn't need to be out there.
No further questions. Nothing further.
You're just.
Oh boy, what do y'all think of
Just watch your
that?
step as you exit, okay?
I found
Thank you.
him absolutely, completely unbelievable. He is the only one with this individual story that really doesn't line up
Attorney
any
Messina, the state's ready.
of the video footage.
Thank you.
Hi, Dr. Crombie. How are you today?
Good afternoon, Tatiana.
Good afternoon. It's a little bit difficult to hear in this courtroom.
Okay.
So as much as you can keep your voice up, we appreciate it. So thank you.
Absolutely.
Dr. Crombie, what is your current profession?
I am a surgeon.
And explain to members of the jury what degrees you hold.
I hold several degrees. I have MD and PH, which is a Master's in Public Health. I have a FACS, which is a Fellow of the American College of Surgeons, and FABA, which is a Fellow of the ABA. I'm double boarded in general surgery and surgical critical care, and I am fellowship trained in burn surgery, which is traumatic burns and reconstructive plastics.
And what hospital do you affiliated with?
I'm part of the Yale New Haven Health System. My primary home hospital is Bridgeport Hospital, but I do also at times go down to Greenwich Hospital. And many years ago when I first started, I was at Yale New Haven Hospital.
In Bridgeport Hospital, that's located in Bridgeport, Connecticut.
That's correct.
And how often are you at Bridgeport Hospital?
At this point in my career, most of my practice is outpatient ambulatory surgery that's done at Park Avenue Medical Center. And then I'm on service, meaning in the hospital to cover burns a certain number of weeks per year. But about once a week, I cover on call, which means that for a period of time, my surgical group has to cover trauma, general surgery, surgical critical care, burns, and wounds over a period of time is typically a 30-hour shift.
And for how long have you been affiliated with Bridgeport Hospital?
I'm at the end of my 16th year of practice. So it's been a very long time.
And if you can give us a rundown of your work experience.
My work experience, it's all of those specialties, in addition to some outpatient and ambulatory surgery as well. So it's general surgery, burns, trauma, critical care, which means people that are sick or very sick on ventilators, need a lot of vitals. I do wound surgery. I do a lot of reconstructive plastics as well.
And could you please explain to the members of the jury and what capacity your expertise is needed at Bridgeport Hospital?
Primarily for burns is what I'm renowned for. If you look up my name nationally, but additionally, again, I do reconstructive plastics. I cover trauma when I'm called to about once a week. Whatever comes in through the emergency room that needs addressing by a surgeon at certain times.
In your specialty of trauma,
Mhm.
explain to members of the jury, are you in one particular department of Bridgeport Hospital or are you called into any department when needed?
Good question. So a lot of the general perception is that we're just sitting there in the emergency room, and that's exactly not what happens. So I'm a surgeon. I'm part of the Department of Surgery, Surgical Critical Care, General Surgery, Burns, Wounds. I know I keep repeating, but just to stay on the point, when there are different types of consults that come throughout the hospital or outside of the hospital, and we're called to either different floors or different sections of the hospital, then we go and we see the patient and we evaluate them. Sometimes it's up on the 10th floor where there's a cardiology issue. Sometimes it's in GI or gastroenterology. Anywhere where there is a need for either any of those particular specialties that we cover, that's where we go. And the emergency room obviously is one as well,
Have you testified in court before?
multiple times.
And do you have any teaching responsibilities?
I do. I'm faculty at Yale School of Medicine, Department of Surgery.
Does that involve teaching residents?
It does, yes. Many residents. We got over 100.
Do you belong to any professional societies?
Multiple professional societies. So the American Burn Association, the American College of Surgeons. I also belong to a number of wound societies as well. I'm chair of the Physician Special Interest Group for the American Burn Association. I am I'm a board director at large for the American Board of Wound and Surgery, effectively. I'm the chair of a conference that's called the John Boswick Symposium, named after a former burn surgeon. So I do quite a bit at the national level and also within the state of Connecticut, the American College of Surgeons within the state of Connecticut.
I'm going to direct your attention to May of 2022. Do
Yes,
you recall working at Bridgeport Hospital at that time?
I do.
And at any given day or night, how many patients would you see?
So I'm on call tonight. I was on call Saturday. I'm typically the Tuesday person or the Saturday person. It can be anytime, anywhere between typically 17 and 20 consults. And then I'm covering about 60 to 65 patients that are on the floor. In addition to that, if anything emergently needs to go to the operating room that needs to be addressed, then I'm also operating on that as well.
What you just recounted, was that about the same way in 2022?
That's a typical night on call for me.
And directing your attention specifically to May 15th, the early morning hours, May 15th of 2022, do you recall working at Bridgeport Hospital on that morning?
I was the overnight person, yes.
And overnight, what hours is that again?
So we usually, in addition to working a regular day, which for me starts about 7 a.m. operating, at about 4, somewhere between 4 and 6, I have to come back to the hospital and relieve my partners that have been covering the hospital. And then I cover all of those services until about 8 a.m. the next morning. So it covers the overnight shift effectively. Each one of us takes our turn. That happened to have been my turn.
Did there come a time when you examined a patient by the name of Thomas Connery?
Yes.
And Do you recall reviewing Thomas Connery's medical records before testifying here today?
I did.
Can I approach counsel, Your Honor? Approaching the witness. Dr. Cromley, I'm going to be showing you what's marked as Exhibit 81 for ID purposes only. Just please review this and let members of the jury know what is that document.
This is the medical record of the said patient, Thomas Connery. Gives a medical record number, which is a number within our Healing Heaven Health System and a date of birth, 11/27/2023, and it is the contents of what is taken out of our electronic chart now since 2015, but the government required us to be electronic and it's printed into paper.
Were those records made in the regular course of business of Bridgeport Hospital?
Yes,
And is it in the regular course of business for Bridgeport Hospital to record such documentation?
it is.
And you had an opportunity to review these records before coming to court today?
I did.
And are those records the same records that you that were generated on the date of service, which was May 15th?
That is correct.
And are these records certified?
Yes.
I'd ask to be marked as a full exhibit.
Attorney Smith?
No objection, Your Honor.
All right, court will accept into evidence dates 81 full.
Dr. Cromley, giving you back states 81. Now, full exhibit, you can now reference states 81. Dr. Cromley, looking at state 81, when was Thomas Connery admitted into the hospital that morning?
5/15/2022. I recall that it was just at the turn of midnight is when we got paged
Okay. And to your knowledge, how was he brought to the hospital?
by ambulance.
And where was he brought upon his arrival?
In the ER, there is an ambulance bay where the EMS providers bring them down the hallway and it goes into a trauma room. We have 3 of them, and effectively they're just big rooms that have a lot of equipment that we might need for emergencies or anything that we need to do.
When Thomas Connery arrived, did he arrive at any kind of specific level, meaning a trauma level or something otherwise? And how do you know this?
So the American College of Surgeons and the American Association of Society of Trauma, they grade the levels of trauma on 3 levels. So the lowest one meaning that you can just consult the physician, it's not emergent. The second one being that there are some injuries that may be concerning and we require certain people to be there. And then the top level, which means that the patient is an extremis, everybody should be there, including respiratory anesthesia, surgery. Everybody that is needed possible. It denotes a call to the blood bank, et cetera, et cetera.
Do you know what level Thomas Connery came in as?
I believe he was a trauma alert, which is the mid-level.
And from your experience and expertise, why was he labeled as a trauma alert?
So per the criteria of the American College of Surgeons for certified verified trauma centers, because he had a penetrating injury of some sort, he immediately bumps up to at least a 2nd level, maybe even a 3rd, depending on a bunch of different factors.
Would that be for all patients who come in with similar injuries such as his?
Penetrating trauma does trigger the 2nd level.
And please explain to members of the jury how you came about, how you were asked to assess his injuries. How were you called to assess his injuries?
So in a typical night on call, I'm the attending on call. I have a chief resident, which is anywhere between a PGY3 and a PGY post-grad year 3 to post-grad year 7, basically. And then there's a mid-level resident, which is the person that primarily covers any consults that come through the ER or any emergencies like this, and then an intern. So what typically happens in many hospitals throughout the United States is that the mid-level or the consult resident goes and evaluates the patient. There's also a separate residency program called the Emergency Medicine Residency Program that also evaluates the patient, and it's part of both the learning process and the incredible need to have multiple parts to patient's care in medical care. And the mid-level resident, we all got the page. The mid-level resident then speaks to the chief level resident, and then they evaluate the patient and call me and give me a head to toe, and then I go and examine the patient.
I'm going to direct your attention to case exhibit, I believe it's 81, page 2, under where it says history chief complaint. Can you please read what it says under that line?
Stab wound, multiple stabbings to the left thigh, trauma alert called at 0042, so 12:42 a.m., direct to trauma 4, which is one of our main trauma rooms in the
Trauma
ED.
room was
4,
trauma 4.
correct.
And how many do you have? Every trauma
We have
hospital?
3 that are active, but we can spin to more than that if needed in a mass casualty incident.
I'm going to direct your attention to States 81, page 6. Towards the bottom of that exhibit under the heading ED Notes by Messer Marissa RN. Can you please read what it says there, starting with the sentence on assessment?
So on assessment, the patient with 4 puncture wounds to the lateral aspect of the left thigh, inferior and superior wounds with hematoma, bleeding controlled, pedal pulses present bilaterally, cardiopulmonary monitoring initiated, VSS, which means vital signs stable. GCS is a measure of the activity and movement and response of the patient. IV access established in the right AC, which means antecubital, which is the inner part of the arm. Lab work collected. Please refer to the trauma narrator for further documentation.
What does all of that mean that you just read?
Okay, let me break it down. The assessment we do, there's parts of a note in the way that we communicate in medicine, which is basically, and the medical students and the residents, they evaluate by hearing the history first, and then by doing a physical exam head to toe. And then there is an assessment, meaning based on the description of the history, the physical exam, and examination of all of the imaging labs, et cetera, what is your assessment? So this is the individual that wrote this, who is a nurse. This is what she is reporting as her assessment for this patient. So 4 puncture wounds, so 4 stab wounds, lateral aspect of the left thigh. So there's laterality, so there's left and right. Lateral means to the outside of the body. Medial means to the inside of the body. So it appears that there were 4 puncture wounds to the lateral aspect, so outside of the left thigh. Inferior means, again, inside. Superior is above, so towards the top, with a hematoma, which is basically a collection of clotted blood. Bleeding is controlled, it appears, is what she is assessing. Pedal pulses means that she touched or somebody touched the bottom of the feet and examined the arteries there. And what that indicates is that there is good blood flow that goes beyond those stab wounds to the feet. And cardiopulmonary monitoring meaning, was initiated, meaning that they hooked them up to the monitor, which is blood pressure, O2 saturations, respiratory rate, amongst other things. Vital signs were stable, so they fell within a specific range. GCS is a Glasgow Coma Scale. It is a universal way that in the emergency room and surgeons
We
communicate,
remember
and it's
that.
based on eye movement, verbal, and then overall movement. And there's a score, 15 is the best that you can get. The minimum we typically give if somebody is even deceased is a 3, because they got basically a 1 for nothing. IV access means that the nurses were able to put the IVs in the right arm, and then they collected the typical blood work that we do.
Thank you.
You're welcome.
Referring you to States Exhibit 81, bottom of page 6 into page 7. Is this where your notations begin?
This is part of my note. Yes,
And is that your electronic signature on this documentation?
it is.
And you personally examined Thomas Connery,
I did.
correct? And in that same Exhibit 81, where it says pre-hospital information, what does that refer to?
Pre-hospital information means that before they got to the hospital and rolled in, emergency medicine services are also providing some type of medical care, and they're documenting that in some capacity. Now, I don't see anything other than when the patient rolls in. So I know nothing about whether or not that's valid or invalid. It just is.
And emergency medicine services, that's EMS?
That's correct.
And it indicates here on States 81, page 7, arrival time and exam time. Is that when you actually examined Thomas Connery?
No, as I stated before, the way that it works is based on the grading of the system. He is a middle grade, so I don't technically need to examine him for a certain period of time. If it's the highest grade, we have to be there within 15 minutes.
Moving to page 8 of States 81, what is the difference between a primary survey and a secondary survey that is listed there?
So again, with the American College of Surgeons and the trauma, a primary service survey means primarily we're identifying the things that can kill you. So airway, breathing, and circulation. And so those are the primary survey that we have to evaluate. Airway, I'll give you for an example. So if airway is not working because they don't have a breathing tube in, you stop there. You cannot move on to identify whether or not they're breathing, because they may not stop breathing until you have an open airway. So that's the time that we get anesthesia to come in, put a breathing tube. And then you keep going down until you're done with circulation, evaluating all the vessels throughout the entire body and making sure that they have good pulses. The secondary survey is then after you've got the patient stable and you've got all that documentation, is really looking at things like eye movement. Do you have blood in your ear? Are there any other deformities because of fractures and stuff like that? So that's all documented as a methodical way so that nobody misses anything.
Now, prior to assessing Thomas Connery that morning, had you had occasion to treat patients with stab wounds in the past?
I have.
And upon examination of Thomas Connery, were his wounds consistent with stab wounds you had?
They were.
And do you base your conclusions on self-reporting, your personal observations, or a little bit of both?
In terms of that they were stab wounds? So it's a little bit of both, but there are also some imaging studies that are done. And within the imaging studies, things that we're looking for are communication of air into the deeper tissues. And he did get what we call a CAT scan. So it's evaluation of the actual soft tissues and bones that showed that the injuries on the skin were consistent with a deeper injury down below.
I'm going to direct your attention back to States Exhibit 81 on page 9. Are those notations a continuation of your secondary survey of Thomas Connery?
They are.
And directing your attention to page 9 under where it says extremities. If you can please read that to the jury and then explain why this was concerning to you.
Sure. So this is an evaluation of the extremity on the secondary survey. Left thigh with 4 stab wounds with no active exsanguination, meaning no active bleeding at the time when we saw him. Inferior anterior stab wound, again, that's the inferior, so inside in the front anterior stab wound with a small hematoma, so small clotted blood. Range, ROM means range of motion intact at the hip joint, knee joint, and with the foot, meaning that his hip, his knee, and his foot moved completely normally for what we would expect of this age. No focal neurological deficits, which means that we tested both motor and nerve, and it was equal to the other side, and there was nothing missing. No vascular deficits, meaning that they were palpable with the different pulses, femoral, popliteal, dorsalis pes. These are all anatomic as we're working down from the hip all the way down to the foot, with an ABI of 0.94. Distal pulse is palpable and symmetric, except for, as noted above, no gross deformities or bony tenderness of the extremities, normal passive range of motion, meaning that there wasn't anything inhibiting us from bending his legs, of the extremities without pain, except noted above, no abrasions, lacerations, contusions, ecchymosis, hematomas, or foreign bodies were noted on the physical exam. I just also want to point out the ABI, which is stands for the ankle brachial index, is another completely subjective where we measure the blood pressure at the brachial, meaning arm, and the ankle index. It should be equal and bilateral on both sides, and it should be 1. There are some elderly patients that have some vascular disease, meaning that they have smoked or they've got atherosclerosis. Sometimes you can have a decrease between 1, but in a normal young man, such as it should be close to 1. So in the area where the stab wound was on the left thigh, that limb was slightly decreased.
Why was it alarming to you?
So when you cut through a muscle, and if you think about it like a steak on end, there's a white thick tissue on the end called fascia. And what that does is as you injure the muscles, which are very vascular with a lot of arteries and vessels and lymphatics, they can swell to the point where it swells within that tight vascular tissue, that tight tissue called the fascia, and it can actually compress important structures like veins, nerves, and arteries. So that's why that number was concerning to me, because A, in a young man, it should not be less than 1, and B, it just shows that there's a significant amount of hematoma, meaning blood, that was starting to decrease some of the flow that was adding to our measurements.
In your professional expertise, would that be something that would be life-threatening?
It can be life-threatening, and it also can be limb-threatening for a
Explain.
young man. So limb-threatening, meaning that as it starts to compress some of those arteries and veins, what happens is effectively it decreases the perfusion or the carrying of blood to the areas distal or further away from where the blood comes. The blood comes from your heart, it comes down into your hips where your femoral artery is, and then it goes out to the furthest point in the lower extremity. And what can happen is if the thigh's pretty muscular, if you continue to bleed, you can actually squeeze to the point where no blood flow is going down to below the knee or below where the thigh is. So that can typically in a non-responsive patient end up being an issue. And even in a responsive patient, it can lead to something called a compartment syndrome, meaning that the compartment is so tight that the pressures in the different area are damaging key structures. And that can ultimately, obviously, we call it ischemia, meaning not blood flow to a limb. And if it's not dealt with in a timely fashion, it can be devastating.
Now, directing your attention to page 11 to page 12 of SACE 81, at the way bottom of that page where it indicates soft tissues, there's a subcutaneous gas noted within the soft tissue of the anterior lateral thigh, best visualized on lateral view. What does that indicate?
That means kind of like I was describing for the CAT scan before, it just means that there was a communication between the outside air and the inside air. And what happens is you can imagine is just when I kind of akin it to like if you were cutting like gelatin, the knife goes in and there's parts of it that will close, but there's going to be a track of air that communicates with the outside that basically is illustrated by this picture.
And that'll be indicative of a knife penetrating.
Some sort of, and not specifically a knife, but a penetrating object.
At the very end of page 12 in SACE 81, it indicates attending comments that Thomas Connery was admitted for observation as the thigh muscles are highly vascular. Why was it important to keep Mr. Connery for a little bit of time at the hospital?
To make sure that he wasn't going to continue to bleed to cause that ultimate demise of what I was alluding to before, called compartment syndrome.
And at some point in looking at page, I believe it's page 14 of SACE 81, there's a notation there from the nurse that indicates that at 3:15 a.m., dressings found to be drenched in blood, dressing changed with Sarah, who was one of the nurses. Is that a notation indicating that the wounds that Mr. Connery has sustained were still bleeding even
That's
for several
correct.
hours?
That's correct.
Dr. Crombie, are you aware of Thomas Connery what blood was taken to be tested for anything at the hospital?
It's very standard for all trauma patients to have their blood drawn.
Standard, and why is that?
Because we are looking for not only to see how physiologically deranged they are, because often despite the fact that our EMT providers are excellent, it just gives us a better clinical picture of what we need to do. But additionally, related to that, it gives us a little bit of an insight into some of the substances that may be masking some of the physical exam symptoms and the radiologic symptoms.
Direct your attention to page 23 of SACE 81. It does indicate that Mr. Connery's blood was tested, and it was tested for ethanol, which is alcohol. Do you recall what the level was?
125.
And what is that for BIC?
So blood alcohol level is a way for us to measure how what the law has deemed as being impaired, and 0.8 or 80 in milligrams per deciliter is what's considered the impaired amount. I mean, obviously that's going to vary depending on your body mass and et cetera, but that's what's legally done. So technically at 125, he has an alcohol on board and it's significant enough to cause impairment.
Is that a BAC of 0.125? Is that without the conversion?
0.125. Yep.
Yep.
With the fact
Point
that
oh
Thomas
eight.
Connery had alcohol in his system, would that have affected his injuries or how he was treated at all?
So Full disclosure, we don't get these numbers right off the bat. Like this is something that comes afterwards, but it is incredibly helpful when it comes afterwards that then the team knows that they need to give more fluid and that the alcohol might be affecting the type of injury that he has. More specifically for him, it's just that he is intravascularly, so he bled and then he's intravascularly dry because of the alcohol, because alcohol is a diuretic. It actually signals, it overrides your kidney's normal homeostasis or balance and doesn't allow you to reabsorb the water when you're dry. It actually signals for you to pee, and that will make you drier effectively. So that's the significance of that in him.
Okay. Being that you did not have these levels beforehand, did you see anything that was concerning to you that you thought maybe he had alcohol in his system, hence causing more bleeding, or he wouldn't heal as fast because he had alcohol, anything to that effect?
No, that shouldn't affect it.
Dr. Kwame, I'm going to show you what's been marked as, one moment.
She did say 0.8, Sherry, but
77.
she was meaning 0.08.
Okay. Yes.
This was a picture that was taken
At the scene.
Do you recall if this is similar, Mr.
It is similar. So we don't see these pictures, obviously, unless EMS has it. I just see the patient as they roll into the emergency room.
And let's take one moment, Your Honor.
Sure.
Showing you the mark state 73. This was a photograph that was taken of Thomas's injuries about a week after, I believe. Are those consistent with where you saw the wounds that I?
Correct. They are consistent. So the left leg, and you can kind of delineate that because there was another leg underneath it that shows the right leg. Lateral is the outside of the leg, like I was saying, and those are three of them. There was one on the other side. So when we talk about this is the lateral, the opposite of that is the medial. There's clear description throughout the chart multiple times of an inferior medial one as well. And the significance of that means that the object, whatever it was, went through and through could have gone through and through to the other side. And that's the concern that I have as a surgeon.
So pointing to this exhibit, indicating here, I don't know if you can see that. Which injury was this? You termed it as?
It should be superior lateral.
Okay. And pointing here to the middle exhibit.
That should just be lateral or anterior lateral.
And pointing to the lower end.
It's technically inferior lateral because it's still on the outside of the leg.
Okay.
Yeah.
And the one we're not seeing here in this exhibit is you said on the inner side.
Inferior. So inferior medial thigh. So inside thigh.
Now, Dr. Crombie, referring you back to States 81, page 12, under assessment plan, what does it say was initially done to help heal or tend to Mr. Connery's wounds?
So the wounds were washed thoroughly with betadine, which is an antimicrobial, and saline, which is effectively salt water. Xeroform gauze, which is a yellow gauze that has some bismuth salts in it, was applied and secured in place with Kerlix dressings, which are the types of gauze that you can kind of wrap around a leg.
Why weren't sutures used? Stitches?
Good question. So I don't know what he got stabbed with. It could have been a branch for all I know. And that is not sterile. That's got a ton of bacteria, a ton of stuff that might still be in the wound. So you do not want to close the wound because then what that allows is to have growth of specific bacteria that are not, they're called anaerobic bacteria. So they thrive where there's no oxygen. So we always leave stab wounds open when we don't know what it is, how deep it was based on the imaging. So it heals from the inside out. So you just need to clean them, irrigate them out, and allow them to heal.
If Thomas had told you or told one of the nurses that he had gotten stabbed with a knife, would you still have not put sutures? So even if it was a knife, not a tree branch as you indicated, would you still have had the same course of treatment?
Yes. I don't know how clean the knife is.
And I'm going to direct you, well, what's wrong? To your knowledge, do you know how long Thomas Connery was in the hospital for?
I don't know. I know that he came in around 12:54. I know that the dressings were changed at 3:15. That's why my note and my attending note doesn't match my residence note because I wanted him to be observed. So, and then what happens is 8 a.m. is there's a new team and a new partner of mine that comes and takes over.
But you do know that he was kept for some time for observation.
He was.
Dr. Crombie, I am going to ask you, in addition to treating Thomas Connery that night on May 15th of 2022, do you also recall attending to a patient by the name of James McGrath?
I did not know his name at but yes.
And do you have a clear recollection of when James McGrath was brought into the hospital on May 15th of 2022?
Yes. So in my recollection, the way that we kind of described it in the surgery team is they both came in around the same time. What we have to do is identify and treat the more critically ill patient, which was, he was unidentified at that time.
Is it safe to say that James McGrath you tended to him prior to attending to Thomas Connery based on the level
Correct.
of the critical care?
So he came in as a trauma code, which is the highest level. So anesthesia was there. I was there. Everybody that I mentioned earlier was there.
And how did your team initially know that he was coming into the hospital? Was it an alert that you had gotten from EMS?
So throughout the emergency room, and again, we're not there. There's something called CMED, which is a radio system that the EMTs and the paramedics and ambulances do to basically triage and give a heads up for the patients that are coming into the emergency room. They had given them a heads up of the nature of how in extremis he was, how much blood there was on the scene. So that automatically bumps him up to a trauma code. So the way that I'm notified is I get on my pager, it says trauma code and gives a very brief description of what it is.
Okay. And why did he come in as an unknown? Explain that a little bit.
Oh, that's just if there is nobody at the scene that can identify them, very well, that's one reason. The other reason is it's unclear whether or not he's a victim of violence. And we also want to just make them an alias and be unknown so that we can just focus on that and not have to worry about all the other stuff.
Prior to coming today, did you have an opportunity to review medical records for James McGrath?
I did.
And when he came in, do you recall what his appearance was?
Very pale and white, and he was on a Lucas machine, which is an automatic machine that performs CPR. There is a plunger that goes over the chest, and then there's an archway where they put the patient's arms to, and it's Velcro too. And the EMS can start and stop, as can the team. The Lucas machine is what it's called, and that allows the EMTs or the paramedics to focus on things such as fluids, managing his airway, etc. Things that need to be done. Yet CPR is being performed.
If it's noted that his appearance was toxic looking, what does that refer to, or what does that mean?
The nurses say that if for some reason the patient looks like they're either dead or imminently dying, but very sick, not good.
Do you know what the acronym ETT refers to?
Yes, endotracheal tube.
And what is that?
That is the breathing tube that gets put into your airway when you can't breathe for yourself.
And the term asystole, what does that refer to?
So there are different types of heart rhythms. Asystole means that there's no electrical activity that the heart is actually showing, nor is there any waveform that will transduce to the heart to be able to give meaningful pumping to circulate your blood.
From both your personal recollection as well as the review of the medical records of James McGrath, when patient presented, do you recall what type of a stretcher he was in?
He was in a bucket loader stretcher.
And what is that?
So backboards are typically flat. If you've gone to any swimming pool, you've seen it on the side there, and it's to allow people when they fall down, emergency people, to be able to slide them onto some sort of board and fix their neck and make them secure and seatbelt them in. I don't know why he was in a bucket loader. I'll be honest with you. Maybe there was a lot of things going on at the scene, and that's the only stretcher that they had. But they scooped him up into that, and then they put him onto the regular rolling stretcher. So they brought him in, and we moved the bucket loader over to the ambulance, stretcher that fits in the ambulance comes in. They put it side by side with the emergency room stretcher, and then they move the patient over, whether it be in the bucket loader or typically just the backboard, over to that. And then we try to take the backboard off, but he was in such extremis that we didn't even, it was just really scooped down all the way into and continued CPR.
So you immediately started working on him without even taking him
There
out
was
of the bucket
there was no stoppage whatsoever.
stretcher. Now, the term ED disposition, what does that refer to?
So at the end of the evaluation of care, sometimes we have to decide where we're going to put the patient. So like, for instance, somebody that needs ICU level care, their ED disposition is to the ICU. If they need to be admitted and they are floor level care, meaning they're not as sick, they don't need intensive care, then they go to the surgical or medical floor.
This is ED disposition expired. What does that refer to?
So that means that the patient is deceased.
May I approach Counselor, Your Honor? Dr. Crombie, showing you listed marked as stage 82 for ID purposes. Do you recognize and stop here?
This is the medical chart of Mr. Unidentified, who's now identified as James McGrath from 5/15/2022.
Did you have an opportunity to review those medical records
I
prior to
did.
testifying here today? And were those records made in the regular course of business of Bridgeport
They
Hospital?
are.
Is it the regular course? Is the regular course of business for doctors and nurses at Bridgeport Hospital to generate such a report when treating a patient?
It is.
And are they under an obligation to record information accurately?
They are, and I am.
And is it a certified documentation?
It is.
I would like to mark this full exhibit.
No objection, Mayor.
All right, court will accept into evidence states exhibit 82, full exhibit.
Bye, Jay Cornish. Have a great afternoon.
Dr. Crombie, I have a few questions just to ask you about stage 82. That full exhibit. Let's reference those.
I just freaked out my dog.
Direct your attention to stage 82, page 13. Is this where your notes begin in attending to James McGrath?
So it's page 13, halfway down the page. This is my history and physical note that is written after the event occurs.
And page 15 into 16 of that exhibit, attending comments. Just refer
That's
that
me.
page. That's you.
Yes.
And if you could just please read what it says at the bottom there.
From my attending comments?
Yes.
Patient came from over 20 minutes away and clearly was on scene for greater than 20 minutes prior to that per EMS. The patient remained in cardiac arrest, meaning his heart had stopped per EMS and no other rhythm other than asystoles, which is what I described to you before, since They had picked him up. A significant amount of blood was described at the scene. Head to toe exam. His pupils were fixed and dilated and non-reactive. Stab wound noted in the left chest, axillary region. No other injuries were noted on the secondary survey. Patient was intubated. However, there was clearly food substance near the ET tube as he vomited on intubation per EMS. End tidal CO2 was confirmed and placement was confirmed of the endotracheal tube. Upon turning off the Lucas CPR assist device, there were no pulses noted in any of the proximal, carotid, or femoral areas. Asystole was confirmed multiple times between the Lucas device and self-performing CPR. One round of ATLS, ACLS was done to include treatment as well with bicarbonate calcium in addition to the epi that was given. No return of any signs of life were noted. Again, it is confirmed on the monitor that he was in asystole, and an ultrasound evaluation of the FAST reveals no cardiac motion, so time of death was called. Father was told of the condition of the patient.
Referring to page 14 of your notes, where it indicates under chief complaint HPI, where it indicates patient was reportedly found on scene in extremis with asystole as his read. What does that mean?
So meaning that the first note of what the EMS does is they have their own monitors that are portable monitors. And when they hooked it up to his chest with all the leads in the proper area, there was no cardiac rhythm whatsoever.
And EMS, and he presented in extremis 30 minutes after starting CPR. On arrival, he had a GCS of 3. What does that refer to?
So that is the Glasgow Coma Scale that I was telling you about earlier. And it's an evaluation of eye, verbal, and movement. So his eye exam was not moving. He was not talking and he was not moving. So that's a 3.
No palpable central pulses. That's pulses anywhere.
So central specifically means that the first place that your heart pumps to is your carotids, which are the 2 big vessels in your neck, and then your femorals, which are down in your groin.
And bilaterally dilated unresponsive pupils and ongoing CPR.
So what that means is when the brain does not have oxygen for a period of 3 to 4 minutes, you start to lose, your brain dies and you lose the ability to react to light. And that's seen typically in exactly this fixed and dilated unresponsive pupils.
Directing your attention to page 8, I believe we're on 82, page 15 of James McGrath's medical records under trauma bay events, where it indicates resuscitation. Those 4 bullets underneath.
Yep. So epinephrine times 2. So they gave adrenaline, which is a drug that we typically give that is naturally occurring in our bodies in the adrenal gland to try to kickstart the heart. It was given 2 times with continuous CPR. No ROSC achieve means that there were no spontaneous live events that were no return of spontaneous circulation was not achieved. Cardiac ultrasound, we have a ultrasound in the trauma bay that can look at a bunch of different things, but we specifically looked at the heart and it was not moving whatsoever. And then patient declared dead at 12:52 a.m.
Dr. Comey, who declared James McGrath dead?
It was technically my resident, but I was there supervising.
And do you recall who went out to tell James McGrath's father that his son had passed away?
So I immediately asked so there's a team that comes in with everybody, and we have pastoral care. We have pastoral care residency program. So they typically try to figure out where the family is. So I turned and I asked where the family was, and they brought me to where Mr. McGrath was. And
Do you have a recollection of telling the father that his son had passed away?
I do, very vividly.
And directing your attention, withdrawn. Dr. Comey, there was some indication that James McGrath had an elevated blood alcohol level that night. Anything about that fact that would have affected his injuries or the fact that he had died?
No.
Regarding the alcohol?
No.
Would you have treated him any differently if
We would
he
have
had
not.
alcohol in his system?
We don't know that at the time, as I stated earlier.
And would he have still succumbed to his injuries even if the alcohol was present?
For this particular injury, yes.
And is there anything, Dr. Comey, that you vividly remember when you took, withdrawn? Was James McGrath ever taken out of the bucket stretcher and put somewhere else at some point?
Yes. So before I went out to go find Mr. McGrath, what we typically do to try to help the family see their loved one for the last time is the whole team, particularly the nurses, will clean up. It's a little messy after we've been working on somebody particularly that had bled significantly. So what we had done is all hands on deck because it was a big bucket stretcher, which is much heavier than it. And when we went to basically pull the bucket stretcher onto a clean stretcher, there was liters and liters of blood that spilled all over the floor in the trauma bay, all over. It was in the bottom of that bucket. So we had to clean that up again. Which is consistent with the type of injury that he had.
Do you have a memory of that?
I do, because I did not want to go get his dad before we cleaned all of that up.
Final question, Dr. Crombie, from your expertise with an injury to the heart, such as the one that James McGrath suffered, what were the chances that he would ever survive such an injury?
Impossible, unless it happened in the hospital and we were right there to crack his chest.
Thank you. I have no further questions.
Attorney Smith,
Would you like me to begin, Your Honor, or would you like?
do you have an estimate on how long the class will be?
I think if Your Honor is okay with going perhaps a little past 3:30, that we should be able to complete the process.
Why don't we keep going then?
Thank you.
Good afternoon, Dr. Condit.
Good afternoon.
We've never met before.
We have not.
We've never discussed this case before.
We have not.
You are here to tell us today about the things that you did after the events that led to these injuries, correct?
That's correct.
And you were telling us that as part of what you did, that some blood was drawn from Mr. Connery, correct?
Correct.
You didn't know that at the time, but you told us that his blood alcohol level was a 0.125,
That's
correct?
correct.
And you said that 0.8 is considered impaired, correct?
Correct.
And 0.8 is considered impaired as far as for legal purposes for driving or for medical purposes or both?
Well, it could be a little bit of both. And I believe it's 0.08 when we do the conversion over.
So a 0.08 is too impaired to drive under the law, correct?
Correct.
And is also medically, is that a different sort of level of impairment than what we?
It is.
It
It
okay.
is. So I guess I should explain that to you. So just like I was saying, like depending on your body mass index, depending on your age, depending on there is a enzyme in our livers called alcohol dehydrogenase, which breaks down the alcohol into the different components. And then the free components are what make us impaired. And depending on how fast those enzymes work, and then the size of our bodies has to do with the depot, and then our bodies, processing through that. The enzymes itself can be affected by multiple different factors, including any meds that you're on. Even if you were to take a Tylenol because you had a sore knee and you were 21 years old, it's going to be a little bit delayed in the metabolism or breakdown of that and clearance of that. In individuals that have a history of utilizing alcohol regularly, they tend to have more of this enzyme around and can clear it quite quickly. So they can seem very functional, despite the fact that the legal limit or what's measured is, significant. There are various tables on this, but there's various different things that affect that. But when this all evolved years ago, legally driving and operating motor vehicles was the 80 deciliters or the 0.08.
In fact, it used to be higher than that, correct?
That's correct.
0.10, and it's
Yeah.
been lowered as
That's
we've
correct.
developed more information about the impairment effects of the alcohol, correct?
That's correct.
And when we have a BAC, that number reflects the amount of alcohol that's already been metabolized and is in the bloodstream at that point,
That's
correct?
correct.
And there's a fairly standard sort of metabolism rate for most people. Is that fair to say?
In general, yes, but just like I was saying, with all of those different factors, and it's kind of like dive tables. They create them based on a bunch of different data, and they come up with the metabolism. It's certain. In an hour, it should be this, and an hour it should be this, and another hour it should be this.
Have you heard that for a male, about 2 drinks per hour would get you to a 0.08?
It's again, there's some. I have heard that. I don't know if I necessarily think that that's totally accurate because when you say male, it could be a 5'2" male, it could be a 6'7" male. And it could be something that one guy's never had a drink in his life. This guy drinks regularly, so it's completely different.
Age can affect that as well?
Age can affect it, yes.
And you mentioned a dive table. What's a dive table?
For those individuals that do scuba diving, the Navy tested exactly almost similar to alcohol, the amount of nitrogen that is in your blood that precipitates out if you dive a certain depth. And they tested it on various naval individuals. And then very similar to the alcohol tables, they have a level of clearance per hour, depending on the depth and the time that you were exposed to the oxygen.
Okay. And you told us that a 0.125 would indicate significant impairment, correct?
Well, I wouldn't say it's significant, but it is impaired again.
Okay. So you don't recall telling us that would be significantly impaired?
No, significant is 500, 600, which I have seen. That's significant.
500 or 600, that would be close to fatal, would it not?
Depends on the individual again.
A 0.50, half of their blood being alcohol, and that would not be fatal?
So it's not a half. So you think 0.5 is 50% of your blood volume. It's actually a measurement of the ethanol or whatever is in your system. So they measure it on an assay, and they actually, it doesn't mean 50% of your blood. It's an assay.
And at a 0.125, you said that may have some effect on his injuries as far as bleeding or things of that nature?
It has an effect, exactly what I was explaining before, is that it's a diuretic. So what that means is that he's legally drunk. Level of impairment, as we've just discussed, depends on the individual. But what doesn't depend on the individual is that alcohol signals you to pee out and override your kidneys' regular homeostasis. So how that can affect your injuries is that if you're already dry to begin with, you have a certain blood alcohol level that your body's trying to clear. I'm assuming they aren't drinking water in between the alcohol that they're drinking. He's bleeding. And then in addition to that, his kidneys are peeing out, taking some of the intravascular volume out of his body. So that can affect your injuries.
At 0.125, would you also expect that to affect his ability to accurately describe how he'd come by these injuries?
Again, it depends.
Could
When
affect
I
his perception.
examined, when I examined him, he was telling me exactly what was described to him.
Could it affect his perception at that level?
It's hard to say. Again, it just depends.
Depends on the
It
person.
depends on the person. It's very different.
Would you expect somebody who had only had 2 beers a few hours beforehand to have a 0.125?
It depends.
I
It
would.
has to go back to that alcohol dehydrogenase enzyme that I'm talking about, how active it is or how inactive it is. And then some of it is also just genetically, some people have more active alcohol dehydrogenase than others.
So you're saying that you would expect somebody who had 2 beers a few hours before you saw them to still have a 0.125?
It can happen.
Just 2 beers to get us to 0.125,
Depends on the individual.
even if it was a number of hours beforehand.
It depends. How do you know it was 2 hours before?
If that's what the person said,
It's hard to say.
it is hard to say, isn't it? It would be unusual. Would you agree with that?
I wouldn't say it's unusual, but it's possible.
And we also talked about a 0.20 blood alcohol content level. You recall that?
I do.
Yes, it is.
That is more than twice the legal level of impairment of
It is.
0.08, correct? And would you consider that to be a significant level of impairment?
It depends on the individual. So if it's a 6'8" football player, maybe not.
When you say if it was a 6'8" football player, why would a 0.20 not be significant impairment?
So again, the way that the law, and I didn't make the law, deemed it is they took an average of individuals' impairments and they measured what their deciliter was. They did a bunch of tests and they said, do this cognitively, move this way. And that's how they came out with a 0.8. And that's now in a larger, more massed individual with a bigger liver, they can metabolize just better. Is a lot. And if it happens to be an individual that, has a history or has that genetic predisposition, each one of us is different. We're a mosaic of all of our genes. It depends on what their level of impairment is.
But you would agree that the law has said that 0.08 is
To operate a motor vehicle
to
or
operate.
motor, yes,
or both.
or both.
Cutting
She's
into
making this
Correct.
sound like it's junk science. I
And
don't
so
like that. If
this
that's the
jury is
case, then
interested
why do we
in
do it at all?
why Mr. Valle did what he did that night. That's not anything that you could help them learn about, is it?
So I am here to describe the 2 patients that I took care of. I don't actually know who Mr. Valle is, I'll be honest with you.
Okay.
But I'm here to talk to you about the injuries that we treated that night and how we intended to save one of the victims.
Thank you.
You're welcome.
Can you redirect? Okay. Thank you, doctor. You're relieved. Thank you. Just watch your step as you exit the witness stand.
We were just saying she was a good witness, and then she goes and does this
Please
craziness
call your
about
next
the BA.
witness.
Thank you, Your Honor. Stay with
Yeah.
Ryan Huntston. stand.
Thank you.
What the heck happened?
You may proceed.
Thank you. Ryan, do me a favor, just sit close to that microphone and keep your voice up. The acoustics in this courtroom is not too good. Thank you. Good afternoon.
Good afternoon.
Can you please tell the ladies and gentlemen of the jury how old you are?
I'm 19 years old.
And you go to school?
Yeah, I'm going to be attending Alfred State University in the fall.
And what are you going to study?
Heavy machinery operations.
And prior to Alfred State University, were you in school?
I just ended a postgraduate year at Bridgeton Academy.
And did you play any sports?
Yeah, I played football there.
And are you working for the summer?
Yes, I am.
What are you doing?
I'm working at the UPS store in Fairfield.
Now, prior to your testimony today, have you and I met?
Yes, we have.
About how many times?
3, 4
And why did we meet?
to talk about today.
And I want to direct your attention to May 14th of 2022. How old were you back then?
I was 16 years old.
And did you go to school?
Yes, I did.
Where did you go to school?
I was in Shelton High School.
And did you play any sports?
Yeah, I played football and baseball.
And what year in school were you back then?
I was a sophomore at the time.
You were a rising sophomore or were you ending your
I
sophomore?
was ending my sophomore year.
So I want to direct your attention to earlier on in the day on May 14th of 2022. You familiar with Griffin Marcinzik?
Yes, I am.
How do you know Griffin?
Griffin's a really good friend of mine. Ever since I moved to Shelton, he's been one of my first buddies.
And did you and Griffin hang out somewhere earlier in the day on May 14th of 2022?
Yeah, I think we hung out at his house for a little bit that day.
Around what time would you say you were at his house?
Getting closer to the evening time.
And at some point, did you leave his house?
Yes, I did.
And where did you guys go?
Natalia Rizzik's house.
And how did you get to Natalia Ridzik's house?
I believe he walked.
Is it close?
Yeah, it's only 2-3 streets away.
And when you got to Natalia Ridzik's house, what kind of things were you guys doing there?
Just sat down, hanging out. She had a couple people over. It was no more than like eight of us there.
Now, were you guys drinking alcohol?
Yes, we were.
And were you drinking?
Yes, I was.
And how much were you drinking?
I would say at her house, no more than 2 beers.
Did you drink at Griffin's house prior to going to Natalia's house?
No, I didn't.
When you went to Natalia's house, did you bring any alcohol with you?
Yes, I did.
And what did you have with you?
I had a 12-pack of Bud Light with me.
And you said you drank 2 beers out of that Bud Light?
Yeah.
Okay. And how long would you say you were at Natalia Ridzik's house for?
30, 40 minutes, something like that.
And at some point in time, did you and Griffin leave Natalia's house?
Yes, we did.
Why did you leave Natalia's house?
Because we were invited to Austin Leifer's house.
And do you know where Austin Leifer's house is?
Yes, it's on Lazy Brook.
And did you in fact go to Lazy Brook Road?
Yes, we did.
And how did you get there?
Tanner Chernowski drove us there.
And when Tanner Chernowski drove you there, was it just you and Griffin?
Yeah.
And at some point in time, did he drop you off?
Tanner, yeah, he
At
dropped us
Lazy Brook Road. Around what time do you think he dropped you off?
off. Gosh. Around like 7, 8 o'clock, somewhere around there.
And around 7, 8 o'clock, what was the lighting out like out?
It was still daylight out.
And at some point in time, was it getting dark?
Yeah.
And when you got to Lazy Brook Road, can you tell the ladies and gentlemen of the jury what happened when you got there?
So we showed up there. We were just walking up the driveway, and then the garage door was open, and we just heard music and noise, and we walked into the garage, and that's about as far as we got in.
Now, when you got to Lazy Brook Road, were you drinking a beer down the driveway?
Oh, no, I still was only at 2 beers.
And you say you got as far as the garage. Why did you only get as far as the garage?
Because as
Let's
we're
hope it
about
doesn't
to
stay
walk
at
into,
just 2
like,
beers.
like the door from the garage, like into the house, there's 3 or 4 people getting kicked out, it seemed like, of that door and getting told to leave.
And do you know who those people were?
At the time, no.
Do you know who they are now?
Yes, I do.
And who are they?
The defendant, Jack Snyder, and Tyler De Silva.
And you say the defendant. Who is the defendant?
Raul Valle.
And is Raul Valle in the courtroom today?
Yes, he is.
And what is he wearing?
Black suit.
And can you please point him out for the
He's right there.
Your Honor, may the record reflect that the witnesses identified the defendant in this case?
Court will allow the record to reflect the witness has identified Mr. Valle.
Now, when you say you were trying to get into the house and the defendant and his friends were being what you deemed being kicked out of the party, tell me what happened at that time.
Him and his friends started just questioning us who we were and asking what our business was there.
And what was your response to that?
Austin had invited us over. I played football with Austin for a year in 8th grade for Shelton. Became pretty good friends with him. And he had told me and Griffin that night, come over, having a party, come over.
When you got to Lazy Brook, did you notice if there was any drinking going on at that house?
Oh, yes, it was.
And when you responded to the defendant and his friends telling them that you were there because you were invited by Austin,
Mhm.
what was their reaction to that?
They didn't care. They didn't seem to ask Austin who we were. They didn't care. They weren't worried about if we were invited or not. They weren't worried about that.
Was the defendant saying anything to you in particular during those moments?
No, not really. It was more of Snyder that was saying stuff to me.
And at some point in time, how long would you think that interaction between you and the defendant and his friends lasted for?
About 2 or 3 minutes.
And then at some point in time, withdrawn, did this interaction happen inside the
Yeah,
garage
all in the
area?
garage. All in the garage.
At some point in time, did the interaction between you and the defendant and his friends extend to outside the garage?
Yes, it did.
Tell us about how that happened.
So basically, it started with Snyder asking me for a beer because I had my 12-pack in my hands. And I actually said, yeah, sure, you can have a beer. And then the defendant asked me for a beer also. I said, yeah, sure, you can have a beer. I gave each of them a beer. And they were just like, they weren't okay with that. They started getting very argumentative with us, still wanting to know who we were, why we're there, and insisting that I give up my whole entire pack of beers for them.
And what happened after they insisted that you give up your beers?
Like I said, I gave each of them 1 beer. It was just like, is that all right? Like, can we just be cool about this? And for a second, it seemed like, yeah. They were like, yeah, sure, it's cool, it's fine. And we're like, all right, cool. Like, can we get by? And then all of a sudden, I get my beer grabbed from out of my hands by Snyder. And then all of a sudden, me and Griffin are getting pushed out, not on our own.
And how were you getting pushed out?
Literally got grabbed and just started being walked out by Snyder out of the garage into the driveway.
And once you got out into the driveway, what was your reaction to how you were being treated?
I was in shock. Like I wasn't trying to be an aggressor in any sort of way. I just had given them a beer, trying to be cool, make some friends, whatever. But they were very just like, fuck you, blah, blah, blah. Who are you? All this, that, and another thing.
And at some point in time, did you get angry with us?
Yes, I did. I got upset with Snyder, and I simply said to him, listen, like, that's not how this is going to happen. And I told him, like, I'll fight you for my beer right now.
And so when you told him you would fight for your beer, what did you do at that point?
He said, okay, sure. I don't know where or who had my beer at that point in time. And I kind of just put my hands up, getting ready to fight him.
Now,
Is this not like the most childish
prior to
thing
you,
ever? Let's fight
getting ready to
over a
fight, do you remember
beer.
what he was wearing? point in
For
time?
the
was wearing,
love
I
of all
believe
things holy.
some sort of Nike hoodie and some shorts.
Do you remember what the defendant was wearing?
Yeah, he had a Ole Miss baseball shirt on.
Show you State's Exhibit 53. Is this what you recall the defendant and Snyder looking like that night?
Yes.
Oh, Sherry,
The
they've all
defendant
been
has
like
some
this.
Helmet on?
Yeah.
You have that on when you initially
Whole
talked?
time.
And he has some type of neck pillow on?
Yeah.
Did you have that on when you spoke to him in the garage?
I don't recall.
So when you get out into the driveway, you squared up with Jack. What does that mean? You squared up?
I put my fists up, like just kind of saying, all right, let's go. Let's do this.
And did Jack in fact put his hands up?
Yes, he did.
And at some point in time, what happened after that?
I'm kind of looking at Jack, just like kind of walking closer to him, like about to go and punch him. But then it happened so fast where I get hit, like right here, I get hit. And I'm thinking it's Jack that hit me. Like it happened so fast, but then I'm like, oh, like he's far away. But it just instincts took over, and I just went and tackled Snyder to the ground.
And at some point in time, how long would you say the fight lasted for?
30 seconds.
And do you know who you were fighting with at
Youth.
that moment?
I was just trying to fight Snyder.
And do you know if anybody else was fighting with you?
I felt a lot of blows to the back of my head multiple times, over and over, repeated, getting like what felt like being punched in the back of my head many times while I was just on top of Snyder. And then all of a sudden I'm getting ripped off by my neck, and that was about it.
I'm gonna show you what's been marked as State's Exhibit 58. Like, have you seen the video from the fight at Lazy Brook?
Yes, I have.
I don't either, Melissa.
Stop right there. So I'm gonna give a pointer right there.
Yeah.
So this is frame 47. The individual here in the red sweatshirt, do you know who that is?
That's Snyder.
And the guy here in the green sweatshirt and the
That's
black shorts,
That's me.
do you know who this is behind you?
That's the defendant.
Okay, just play it a little bit. Frame 100, this individual right here to the left, do you know who that is?
That's De Silva.
Now, after this fight ended, what did you do?
I got my beer back and I left.
Do you know how you got your beer back?
I believe the lifer's mother gave it back to me.
And was there any arguing back and forth going on after this fight ended?
No.
You just grabbed your beer and you took off?
Yep.
Now, when this fight occurred, do you know whether or not, would you recall where Griffin was at the time?
He was like, I don't know.
You can't see him in the video.
No, he's not in the video. He's like over to the right more.
Okay.
Like
But he
you
was
kind of
close.
see where those people are standing behind it to the right.
Yep.
He's like a little bit more behind them and to the right. I don't know. I think somebody like grabbed him and
Okay.
like held him back, not letting him.
But in other words, he was close to see what was going on, right?
Yes, Griffin definitely so.
Now, at some point in time, you grabbed your beer. What did you do? Walk up the driveway?
We'll walk down the driveway.
Walk down the driveway, excuse
Yeah.
me. Okay, when you walked down the driveway, what did you do when you got to the end of the driveway?
Me and Griffin were kind of just standing there like, well, we got to leave, but we don't have a ride or anything like that. But then I can remember there were girls down at the bottom of the driveway and they offered to give us a ride home.
Showing you State's 59.
It was likely
See
not the
that? You see
price,
State's 59?
Yes, I
Sherry,
do.
that was the issue. Getting
Who's
it
this
because they
individual
were all
back here?
That's me.
underage.
That's you?
Yep.
And was this picture taken before or after the fight?
Oh, that's after.
And can you see, if you look close enough, looks like you have look like you're,
DJ,
Like,
if
what's
his
that? Yeah.
recollection is true.
who's this individual here to the left of you?
That's Griffin.
Okay. And did you know any of these girls that night you walked down the
I
driveway?
did not know.
Why were you involved in this picture?
I don't know.
Because somebody else took it?
Yeah.
Did you get a ride from Lazy Brook after this picture was taken?
Yes.
Who took you?
One of these girls.
And where did they take you?
Back to Natalia's house.
And when you were at Natalia's house, did you drink any alcohol there?
I don't know.
How long would you say you were at Natalia's house after they gave you a ride there? How long were you there?
10 minutes.
10 minutes? Now, at some point in time between Lazy Brook and Natalia's house, did you become aware of a group chat that had started?
Yes.
And tell us about that.
That was a group chat that I had been added to a week or two prior, actually.
Why were you added to it? Do you know why?
I really don't know, to be honest. My buddy Michael Kinnick added me to it. It was his little basketball group chat to go play at the community center with some buddies. And I just remember that group chat. Like there would be a lot of shit talking that happened in that group chat, like all the time. And he just one day added me to it and was just like, talk some shit to these kids, blah, blah, blah. That's really all I remember.
So you
about it.
didn't actually go play basketball?
No, you could ask any of my friends. I don't really like playing basketball.
Now, do you know whether or not the group chat involved any of withdrawing? The individuals that you just got into an altercation with back at Lazy Brook, did they go to school with you?
Just Griffin.
Griffin went to school with you, but did the defendant go to school with you?
No.
Do you know where he went to school?
He went to St. Joe's.
What about Jack Snyder?
He went to St. Joe's as well.
What about Tyler DeSilva?
He went to St. Joe's.
Do you know if any of the girls in this picture here did
you notice that sneer when he said St. Joe's? St. Joe's.
You know where they went to school?
I believe St. Joe's.
Okay. Now, in this group chat, were you aware as to whether or not individuals from St. Joe's were added to the group chat?
I was not aware. I saw a lot of phone numbers being added to it, but I didn't know who was who and all that.
Do you know whether or not, not what was said, but do you know whether or not any commentary that was going on in the group chat when you were driving from Lazy Brook to to Natalia's house had anything to do with what had just happened at Lazy Brook?
No.
Were you in fact involved in the group chat from Lazy Brook to Natalia's house?
Not that I recall, no.
Do you know whether or not Griffin was at that point?
Not that I recall.
So when you get to Natalia's house, you said you're there for 10 to 15 minutes?
Yeah.
And at some point in time, you leave Natalia's house?
Yes, I did.
Why?
Charlie came and picked us up.
Charlie who?
Connery,
And how do you know Charlie Connery?
good friend of mine.
And did you go to high school with him?
Yes, I did.
Now, at some point in time, after you leave Lazy Brook, when you get to Natalia's house, do you text message anybody about what happened to you at Lazy Brook?
No, everybody like already knew for some reason. Like I didn't go around telling people all this and that about what happened. I didn't really care that much. I didn't tell anybody about it. Everybody just already knew.
Well, in fact,
Okay, DJ, I completely agree with you. The problem is in this particular situation, you're dealing with testosterone and teenagers with not fully formed brains, and they were goaded into going to the home where the deadly fight took place. And we've heard anywhere from 7 to 20 people against, for all intents and purposes, 2. So I don't know when. I understand what you're saying about getting a weapon, but at what point do you start to feel like, I don't know that I can get out of this? So just some perspective on it.
at Lazy Brook, did you go there to fight?
No, I just came because Austin invited me.
Now, so Charlie Connery came and picked you up from Natalia's house. Where did he take you?
To the richest house.
And when you say the richest house, who's the richest?
Tyler Rich.
How do you know Tyler Rich?
I just played football with him that past year.
Did you go to school with him?
Just for like that sophomore year because due to COVID, like freshman year, all that stuff. So freshman, sophomore year, you could say, yeah, I went to school with him.
States Exhibit 5, you recognize this house?
Yes.
Whose house is that?
Tyler Rich's house.
And when you got to Tyler Rich's house, did you go in immediately inside the house?
Yes, I did.
And how many people would you say were there when you got there?
20 to 30.
And when you got there, what kind of things were going on inside the house?
I just had like people coming up to me and questioning me like what had happened. Just wanted to know what had happened. I wasn't like everybody like I said before, they already knew. I don't know how they knew, but they knew what had happened, and I just simply explained to the people that asked me what had happened.
And did you in fact tell them what happened at Lazy Brook?
Yes, I did.
Now, when you were aside from what you told people happened at Lazy Brook, what other things were going on inside Tyler Rich's house?
Conversation.
People hanging out?
Yeah.
Were people drinking alcohol?
Yes.
Okay. Did you see who was drinking alcohol, or was it just kind of just there and people
Yeah.
just what kind of alcohol was being consumed? Do you remember?
Just beers or a seltzer or something like that.
Did you bring your beer
Yes.
or what was left of them with you at Tyler Rich's house?
Yes, I did.
Did you in fact drink any alcohol when you were at Tyler Rich's house? One beer? Now, when you got to Tyler Rich's house, how did you enter the house? Do you remember?
Through the cellar side doors.
Do you recall where the cellar side doors are?
Yeah, it's on the right of the house.
Let me guess, a Bilko door.
So I'm pointing to this area here. Is this around the area where you came into the house?
Yeah.
Okay, so it would be what, on the other side of this AC unit?
Yeah.
And when you got there, actually, withdraw. Showing you states 54. Do you know who that is?
It's Faison.
And how do you know Faison?
Just went to school with him, played a season of football with him.
Do you know whether or not Faison was at Tyler Rich's house when you got there?
I don't know.
Or was he there at some point in the
Yes.
night? Showing you states 55. Do you know who that is?
Yeah,
Who is that?
that's Tommy Connery.
And how do you know Tommy?
He's Charlie's older brother.
And was he there when you got to Tyler Rich's house?
I believe so. I wasn't really looking around to see who was there, who wasn't there, but yeah, I believe
You
he
said there
was.
were 30 people there.
Yeah, he was there.
Did you take into account every single person that was at Tyler Rich's house
No.
that night? But do you recall seeing Charlie there? I mean, Tommy there?
Yeah.
Showing you space 57. You know who this is a picture of?
Yes,
Who is that?
that's Jimmy McGrath.
And how do you know Jimmy McGrath?
I'd met him one time previously at Tyler's house, I think a few months beforehand. That's really my only relation with Jimmy.
Do you recall seeing Jimmy at Tyler's house?
Yes, actually, I remember talking to him. Actually, he was one of the first people I did talk to when I got there. He was asking me what had happened. That
About
night.
Leesburg incident.
Exactly, yep.
Exhibit 56, who's that?
Me.
And do you know when this picture was taken?
In the hospital.
Now, are you familiar with Enrico Fiola?
Yes,
How do you know Ricky?
very good friend of mine.
Did you
Chicky
go to school with
Ricky.
him?
Yes, I did.
And how about Sal Perry? You know Sal Perry?
Yeah.
And how do you know him?
Played football with him.
How about Mike Sampieri?
Yes.
How do you know him?
Just friends. Like, just got to meet him when I first got to Shelton. We became good friends. He went to a different high school, but we still remained good friends.
How about Alex Bernstein?
I'd met him like 2 or 3 times prior, just when I was with Tanner, hanging out with him. Alex would come around every now and then.
Now, the individuals I just mentioned, were they all at Tyler Rich's party? Do you remember seeing them?
Yes.
Now, after you got to Tyler Rich's house and you were telling people what had happened,
Mhm.
did you guys kind of just hang out for a little bit?
Yeah.
Do you know whether or not this basketball group chat, was this going on at the time?
Yeah, like I wasn't really too involved in it, but I was feeling the notifications going off in my pocket on my phone. My phone, I felt the buzz going off on my phone, and I knew there was stuff being said in there. I just don't know what was being said exactly.
Do you know who was saying anything? And you don't know? You
No.
did you glance at it and say, oh, that's
I would just look at it and be like, oh, whatever, put it back in my pocket.
Now, at some point in the night, did individuals show up to Tyler Rich's house that weren't invited?
Yes,
Okay. And how long would you say you were at Tyler Rich's house before that happened?
10, 15 minutes.
And how were you made aware that these individuals showed up to Tyler Rich's house?
Everybody was just like, they're here. They showed up, and people started walking outside.
Were you made aware of it through other individuals in the house, or were you also made aware of it through the group chat?
Just other individuals in the house.
Not
And
according
when,
to Tommy
You
Connery.
were made aware that they were here. What did you do as a result?
Walked outside
And how did you walk outside?
through the cellar doors that I came in from.
And when you walked outside, I'm going to show you this exhibit here. Page 49. When you walked outside, can you tell us where did you walk from the house?
Through the side where the cellar doors are, and then kind of through the driveway, and then the car was parked roughly right in front of the driveway.
So if I correct, you walked this way, for all intents and purposes with this exhibit, there's a blue truck here.
Yeah.
You walked down the driveway,
Mhm.
and you're saying the car was parked somewhere in front of the driveway?
Yeah, maybe a little bit farther back, but yeah, right about there.
Was it parked on the side of the road? the
No,
middle?
it was more like right in the middle of the road.
So was the car parked somewhere around here?
Yeah.
Okay, so if the record can reflect, the lower portion of this exhibit, just to the left of the trees on the right side of Laurel Glen Road, towards the middle of the road.
Noted for the record. Thank you.
And when you saw this car on the road, what did you notice about it? Did you notice what type of car it was?
Yeah, it was SUV.
And showing you State's Exhibit 30, does that seem to be what you saw that night?
Yes.
And which way was it facing? Was it facing towards Adams, or was it facing towards Farmhouse? The Exhibit 1's behind you if you want to.
It was facing towards Farmhouse.
You need to use this. And did you approach this vehicle?
Oh, yes, I did.
And when you approached the vehicle, what side of the vehicle did you approach?
The driver's side.
And how far away did you get from the vehicle when you stopped, when you walked up to it? How far away?
I was right next to it.
And did you talk to anybody in the vehicle?
No.
Did you notice anybody in the vehicle?
Yes.
Who did you notice?
I noticed Snyder driving, and then I noticed the Silva, Raul, and Mackenzie Trafficanti.
Did you notice anybody else in the vehicle?
A few others, but I didn't know who they were.
And can you describe, did you have, at some point in time, withdrawn, how many of you approached the vehicle?
10, 15.
And when you approached the vehicle, did anybody have a conversation with anybody in that vehicle?
Yes.
What was the conversation like? Not what was said, but what was it like?
It was, I don't really know how to explain it. Like, I feel like there was multiple different conversations going on throughout the vehicle. Like, I feel like someone was having a conversation with the front passenger, someone was having a conversation with the driver, somebody was having a conversation with the people in the back seats. So I'm not really too sure what was said, but it was the overall tone of it was totally like chill and like normal. And then there were parts of it that were aggressive, and
why did it get aggressive?
because they had jumped me.
And did you say anything to anybody when you were there?
No, not that I recall.
Do you recall if the defendant said anything to anybody?
No.
Now, at some point in time, you said that it got aggressive?
Yeah.
And when it got aggressive, tell the ladies and gentlemen of the jury what happened when it was getting aggressive.
Cans started getting thrown at the car. And then the car started whipping up and down the road.
Now, when you say cans got thrown at the car, who threw cans?
Multiple different people.
Did you throw any cans?
Yes, I did.
And what kind of cans did you throw?
I threw my Bud Lights that I had. So
Were they empty cans or were they full
they were
cans?
full cans.
Okay. Do you recall where you threw the can?
I believe I was on the other side of the car at this point, so on the passenger side now. And I believe I hit the door, the passenger side door. And then the other can I threw completely missed the car because I believe the car was moving at the time.
I hope this is the beer you were going to fight
Yeah.
for that you're throwing at the car now.
That yourself?
I did not do that, no.
So if that was done that night, that was done by somebody else?
Yes.
If it was done that night?
Yeah.
Now, after the beer cans were being thrown, and other things were being thrown at the car, did anybody else put their hands on the car? Was there anybody else doing anything else to the car?
Not that I recall, no.
And you said the car at some point left?
Yeah.
And where did it go?
Just up and down the road.
When you say up and down the road, if you're looking at State's Exhibit 1,
It was just going back and forth like this way.
and when it was going back and forth, what, if anything, was the car doing?
Going really fast.
Were they throwing anything from the car?
No,
You don't remember any of that?
no.
Where were you when the car was going up and down the road?
In the driveway.
And were you paying attention to it the whole time, or were you talking
Pretty
to other
much.
people?
A mix. Like I would pay attention to it, then I'd talk to the person next to me, something like that.
Now, when you were initially at the car, do you recall who was with you out of all your friends?
No, I wasn't worried about any of that.
Why can't you recall who was with you at the time?
I just wasn't looking for who was with me. I just knew it was my friends, people that I knew weren't going to do anything to me.
Do you know if Tyler Rich was there?
No.
Do you know if Griffin Marcinzik was there?
No.
Do you know if Ricky Fiola was there? Now, when the car went up and down the road and you were in the driveway, you said?
Yeah.
You said you were just talking to your friends, kind of paying attention. Were you kind of looking down the road? What were you doing? Okay. And you said you were talking to your friends. What friends were you talking to? You remember? Why can't you remember?
Just normal conversation. Just can't remember.
Can't remember the particular person you were talking to? At some point in time, did the car stop driving up and down the road?
Yes.
And where did you see it stop?
Like right at the corner of Farmhouse and Laurel Glen.
And when it stopped at that corner, what, if anything, do you remember happening next?
I can remember Tyler Rich running down there after the car, and I actually I didn't go fully down there, but I also kind of like walked about halfway down the road towards it.
So
Remember, Tyler
Showing
Rich
distance
told us
to
he
the pier.
walked.
can you show me on State's Exhibit 49 where you walked down to?
To about like where all the trees are. I just remember the trees on my side,
The trees here,
the other side of the road.
these trees?
Yeah.
So just past Tyler Rich's property on the left-hand side where there's these, looks like pine trees?
Yeah.
You stopped right around here?
Yep.
So if the record can reflect, he's on the left side of the road, just past the 43 Laurel Glen property, next to what appear to be pine trees next to it.
Record shall reflect it. Thank you.
And when you were there, how far away were you, do you think, from where the car was?
Gosh, I don't know. Several feet away from the car.
Like hundreds of feet, maybe 100 feet, a couple hundred feet?
I don't know.
Were you close enough to see anything going on down there?
Not really. I was just able to like make out like people and that there were people down there.
And what did you see?
It's like people talking. It looked like really. That's not
And
it.
when people were outside the car or inside the car?
Both.
And when people were down there talking, do you recall if any of your friends were down there at the same time?
Yeah, I know Tyler Rich was down there.
Did you know if anybody else went down there? Did more than just Tyler Rich go down there though?
Yes.
And do you recall whether or not, outside of talking, did you see anybody get into any physical altercation or fight down there?
No.
Did you see anybody throw anything down there? No. How long would you say that you were watching what was going on down the road at that point in time?
I think I watched for like 30 seconds and I just stopped caring and I walked back to the house.
You walked back to the house. Did you go back inside the house?
Yeah.
So tell us how did you get back inside the house?
Same way that I went in previously through the cellar doors.
So you walked, did you walk down the road, cut across the property and
Yeah, I
back
think I
inside?
through the yard and went through this.
What on earth?
And when you got back inside Tyler Rich's house, what did you do when you got back inside the basement?
I just like kind of stood there for like a minute or two. Everybody seemed to be in there. And then all of a sudden I just hear, they're back. They're back. They're in the yard.
Now, before you heard they're back, what kind of things were you guys doing? Were people still drinking, having a good time, hanging out?
Not really anymore. Everybody's kind of just like, this night's over. Nothing good about it.
What time of day was it? Was it late?
I don't know. Like,
If you can't recall, you can't
I
recall.
can't really recall.
It wasn't light out though, right?
No.
And was it, when you were outside, was it dark enough that you couldn't see in front of you?
No, it was a nice night. Like it wasn't dark. Like it wasn't pitch black outside. Like you could see the person in front of you. You could see like somebody 10 feet away from you. You could make them out.
Were there any other lights around the area at the time? Do you remember if there were any lights
I
from
think
the
there
house?
was like a sensor light from the house, but that's really all I recall.
And you said at some point in time, you heard somebody say they're back.
Yeah.
When you heard somebody say they're back, what did that mean to you?
I don't really know what it meant to me. I just instantly was like, I want to go see what it is.
So you were curious?
Yes.
And because you wanted to go see what it was, what did you do as a result?
I immediately went right back out the cellar door and walked into the yard.
And when you walked into the yard, where did you go? Do you recall where you went? Can you show me and say it's Exhibit 5?
I'm somewhere behind like this red bush.
So you're somewhere over here?
Yeah.
So the record can reflect, I'm pointing to the left side, just behind the red bush.
Record can reflect. Thank you.
And when you come outside and you're near this bush there, what do you see when you come outside?
I see the defendant and then I see DeSova.
And can you tell us on State's Exhibit 5 where you saw them?
About the same area. DeSova was like, if I'm looking at them, DeSova was behind the defendant to his right a little bit, maybe 3 or 4 feet.
So if you're looking this way,
Yeah.
the Silva's over here.
Yeah.
Okay, and the defendant is where?
Right in front of me.
And tell us about your interact. Did you have an interaction with these two?
Yes.
Just tell us about that.
So when I walk outside, the defendant had just like put his shirt up over his head. Like, I can't do it right now, but he like put his shirt over his head and was just like quietly, very calmly saying, "Where's Aiden King? Where is Aiden King? I want to see Aiden King." And just kept repeating that over and over again.
Did you ask him why you wanted to see Aiden King?
I wasn't really worried about it. I didn't care.
And what was your reaction when he was asking about where Aiden King was?
I just was like, "Don't worry about it. I'm right here. What's your problem? Like, why are you back here?
Yeah. And what was his response?
Where's Aiden King?" And then I caught like, I was like, "Why do you have your shirt on your head like that?" I was saying that. And then I pulled the shirt off of his head, not like hard or anything like that, but I just grabbed it, I pulled it off of his head. And then all of a sudden like that, it was just a totally different person. And it like just got crazy.
What do you mean?
Like the defendant was really calm and just quiet and was just like, "Where's Aiden King? Where's Aiden King? Where's Aiden King?" And I'm, like I said, I don't know. I don't care. Like, I'm right here. What's the problem here? Pulling the shirt off of his head. And then the second I pulled the shirt off of his head, just starts freaking out, like get very upset and argumentative and forgot about Aiden King and did worry only about me and the people next to me.
And when you say argumentative, what was he doing?
Just like getting real fast and just like, "Oh, like, you took my shirt off my head. Like, like there's going to be a problem now, blah, blah, blah." Like just all types of stuff like that.
Do you recall when you were talking to the defendant in the yard, do you recall who was near you at the time?
Yeah, Nikki DeJesus and Ty Wood right next to me.
And do you recall, if you can, was there anybody near Tyler DeSilva?
Oh, no, I wasn't worried or paying attention to Tyler Silva at that point in time.
And when the defendant started to react the way he did and get crazy, as you said, well, what if anything happened next?
Me, Nikki, and Ty immediately were just like, we're from me to the microphone at this point now, away from him, just looking him right in the eyes, and we're just chirping each other back and forth.
And when you say chirping each other, what does that mean?
Talking shit.
Okay. And how long did that last for?
30 seconds, 45 seconds.
At any point during your chirping back and forth, did you ever tell the defendant to leave?
Oh, no.
So after about 30 or 40 seconds, what happens next?
Out of nowhere, really, Tyler Rich punched him in the face.
Do you know why he punched him in the face?
He was on his property. I'm not really sure other than that, though.
But how did you see Tyler Rich punch him in the face?
I just saw like his fist and just hit him in the face.
Come over across. Where was Tyler?
Well, I don't know where Tyler was. I just like literally like I was looking the defendant right in his eyes, like right in his face. Like that's all I was looking at. I was locked in on that, and Tyler Rich's fist just punches him.
How do you know it was Tyler's fist?
I figured that out after the fact.
So you didn't know it at the time?
No, at the time.
But it was one of your friends that punched the defendant in the face?
Yes.
And when that happened, what happened after that?
I kind of it's like weird from there. Like I just kind of go at the defendant and I punch him in the face like 2 times.
And when you did that, did the defendant engage you?
Oh, yes, he did.
And can you tell us a little bit about how?
So like he was stumped, like he's like when he got punched in the face, he stumbled back and just kind of fell. And then that's where like I kind of like got over him and I punched him in the face. And then all of a sudden I just feel like a weird sharp pain in my side. And I just kind of went like this. And I went like this and I looked down to this and I see him with his fist clenched up like this and kind of like his shoulder and like bicep area right here were like held back by something. But he was going like this. And I'm you can say I was like on top of him at this point, but he's going like this. And I just see like a jabbing motion towards my side. And that's where I felt like the stick right prior. And then all of a sudden I'm just like, I got to get away. Like I got to get out of here. And I get off and I just walk away.
And how many times would you say the defendant hit you?
Oh,
Do you recall?
I mean, I got stabbed 3 times, but I don't know. He was just going and going. Like it was not like he wasn't trying to hit me in a certain spot. It was just like just jabbing over and over and over, just trying to poke me basically.
And once that happened, you said you had to walk away.
Yeah, I just like, I don't know, like some instinct in me was just like, get up, get off, like get out of there.
And when that happened, how did you feel?
I was just like dazed and it's like really like blurry and just like, I don't know. It's just, it's honestly that entire part of the night, like is the like least like there I am, I would say.
Okay. And at some point in time, what are you doing in the yard after this happens?
I realized that De Silva is in a fight with his own like group of people. And I kind of just stood there and watched.
And do you recall whether or not you engaged in that fight at all?
No.
Now, how long would you say that whole fight took place?
A minute.
And when the fight was going on, what kinds of things do you recall seeing about kind of watching the De Silva fight?
What do you mean by that?
Well, I mean, you kind of just stood there, you said, and watched, right? What were you watching? What were you seeing?
Just people throwing punches, I guess. And that's really all I can recall about it.
When you were engaged with the defendant, do you know whether or not there was more than one person engaged with him?
No.
It was just you and him?
Yeah, from what I know.
And at some point in time, when you stop, when you back off from the defendant, do you see where he goes?
No.
Now, when you recall, if you can recall the De Silva fight, do you recall how many people were engaged with De Silva?
3, 4 people.
3, 4. After the fight ends, at some point, do you realize that you're injured?
So like kind of as De Silva's getting like pushed out, my buddy Ty Wood was right next to me again. And he's like, dude, are you okay? And he's seen my clothes and like pointed it out. And I already started to bleed through my sweatshirt and my shorts. And that's also when I heard my lung collapse in my chest. And I don't know how to describe it, but like, it was like bubbles coming from out of my chest. And I just immediately got super like scared and I didn't know what was going on.
And when you say you were bleeding,
Yeah.
did you say anything how did you realize that you had been injured?
I just kind of lifted up my shirt and looked and I was like, holy shit, like I was stabbed.
And when you realized you were stabbed at that moment, did you hear anybody scream anything?
No.
Did you see anything else at that point? What was going on?
I kind of just went into like, I don't even know how to describe it. Like I thought I was going to die. Like I heard the bubbles come from out of my chest and I just immediately thought the worst. And I walked myself back in through the cellar doors into the basement and sat down and was like, I want water.
Now, when you were fighting with the defendant, did you have a weapon on you?
No.
Do you recall if Ty Wood had a weapon on him that night?
No.
Do you recall if Nikki DeJesus had a weapon on him that night?
No, none of my friends carry weapons.
So I'll show you State's Exhibit 16.
So this is after he'd already been stabbed.
Okay, now.
His timing is
This
at
individual right
work.
here on the left, green sweatshirt. Do you know who that is?
That's me.
That's you?
Yeah.
Do you recall at this moment in time in the video, first of all, have you seen this video before?
Yes.
And do you recall based on your recollections of when you were engaging with the defendant, is this video before or after you were already stabbed?
This is after I was stabbed.
So how is it that you're standing there watching Tyler De Silva and how is it that you don't know you're stabbed at this point?
I just didn't know. Like I just had so much adrenaline going through me. I was like, this is the point in time where I like just something told me in my head, get up, get away from this. Like, and that's where I am now. Like that's where I kind of got up and I kind of just walked and was like, all right. And that's when I realized like there was a whole nother fight going on. I didn't even know really there was another fight going on. I really thought it was just me and the defendant.
And at some point in time, actually, there was. So at some point in time, you recall hearing, he's got a knife, he's got a knife?
Yeah.
Okay. At some point in time, at what point in time do you realize that you're stabbed? And then you indicated you went down, you talked to Ty Wood, and then you go into the basement. At what point, I guess in that timeline is my question.
Like the same exact time.
So you hear, he's got a knife, he's got a knife,
And Ty Wood's pointing out to me that I got stabbed.
and then you're lifting up your shirt? Now,
So that means that entire stabbing would have been caught on the video. I'm confused by their testimony.
I'll show you State's Exhibit 61. Can you see that?
Yeah.
This individual here on the left with the phone out.
Yep.
Do you know who that is?
That's Ricky Fiola.
And at this point in the video, you're already stabbed.
Yes.
So is there a portion of this video that does not capture? Had this video started earlier, you would have seen the entire fight.
Yeah.
State 63. Again, this is, oh.
Me.
Do you know who this is here?
That's Sal.
Sal Perry?
Yes.
This individual here with no shirt on? You know who that is?
Alex.
Alex Ferguson?
Mhm.
How about this kid here with the red hat?
Michael Samperry.
And this is,
Silva.
and do you recall being here in this moment in the video?
That's like the only like point of view like I remember of like watching Silva. Like this is like what I remember from
Okay.
that. Yeah.
And it's a few seconds after this that you realize that Ty Wood comes over.
That's like when everybody started figuring out they were stabbed. Like I want to
This
say
is
like
Vivica.
Faison might have been the first one that realized he was stabbed, and he was like, "Holy shit! Like I was stabbed." And then everybody's just like, "Whoa! Like what's going on?" And
When you realized that you were injured, did you notice if aside from Faison, did you notice if anybody else was?
No.
You kind of just lifted your shirt up, went right into the basement, and
pretty much.
sat down, said, "I need a glass of water."
Yeah.
Did anybody else follow you into the basement?
Some people did, but I just don't. I don't remember who it was. Some people did follow me into the basement, and somebody did grab me a glass of water, and then they helped me out back outside because they were like, "The ambulances are coming. They're about to be here. You got to come back outside." But I don't remember who it was.
Why don't you remember?
It was there was just so much going through my head at that point in time. Like I truthfully thought like I was gonna die. Like it was so hard for me to breathe. I didn't know I had a collapsed lung. I heard those bubbles happen in my chest, and I was just thinking the worst. And I truthfully thought like I was gonna die in that front yard or basement that night.
Did you know what was going on at that moment?
No, not really. I was just kind of in my own world, just like, don't die, just one breath at a time. Like that's literally what I got down to. By the time I was brought back into the yard and my lung was so like collapsed and stuff, like
Could you breathe?
like barely, I was like that. Like I barely was able to breathe, and I was just like one breath at a time. Just I literally took it down to seconds. Like I was thinking so small. I was just like, just one step at a time, and I'll make it. I'll be okay, and all that stuff. But yeah, I was just so in my own world, just thinking about life and my life to that point in time. I truthfully thought I was gonna die. And
Maybe this might be a good point. Stop for the day.
So we are going to adjourn for the day in a moment. So before I do that again, I'm going to do my daily reminder to the jury. So again, please, you must abide by the rule.
Okay. Yes, that was not Oscar that came to visit me. That was my little girl, Vivica. She decided that she needed some mama attention. So she got it, of course, because she is my little diva princess and she gets everything she could ever want in life. Spoiled, rotten little girl. Okay,
Fight
let's
started. Did you anticipate the fight being?
let's head to day 5. So JBZ, Raul is still yet to come. He will not take the stand until the defense gets the case. And we are still on the state's case at this point. But, and let me look. He does not take the stand until day 9. So we've got a little bit of time before we get him on the stand. But let me get us going here. And
Defense Secretary.
next
Very good.
day.
Attorney Durso, you may continue on with your direct examination of the witness.
Thank you, Your Honor.
Thank you.
Ryan, I think yesterday when we left off, we were talking about the fight. Just prior to the fight starting, was the group chat still going on?
I can't recall. I don't know.
Do you know whether or not, you had indicated that your phone was buzzing in your pocket?
Yeah.
Do you recall whether or not you said anything in the group chat?
I think I mentioned one time just calling them pussies. That's it. That's all I said. I only said one thing.
Okay. And when you came out into the yard to confront the defendant and Mr. De Silva, were you closer to Mr. De Silva or the defendant?
The defendant.
And at any point in time during the night, do you recall fighting anybody other than the defendant?
No.
So when the fight, I think we played the video yesterday. Did we play the video yesterday? When the video was playing, when it starts, is that the beginning of the actual fight, or from what your recollection is, or did that, when did the fight, with regards to the video, when did the fight happen? Was it?
That video is probably 20 seconds into the fight.
Okay. And 20 seconds into the fight, you had already fought with the defendant at this point. And at some point in time, what are you doing after you, well, tell us again how you fought with the defendant.
So I kind of was just over top of the defendant, punched him in the face 2 times. And then I just felt a jab in my side, and I looked down and I see the defendant with his right hand clinched up in a ball like this, and he's just poking at my side.
Did you see any weapon on him?
No, I didn't see a weapon or anything. I just seen his fist and just going like this repeatedly over and over again, and just right there on my side.
And when that happened, after that happened, what did you do?
I just like some instinct in me just was like, get off, get away, like just like that. I don't know how to explain it.
And at some point in time, did you lose sight of the defendant?
Yes.
Did you see where he went?
No.
And did you see the defendant after that, before the fight ended? Did you see him after the fight ended?
No.
At some point in time, do you recall watching the fight with Mr. De Silva?
Yes.
And when you were watching that fight with Mr. De Silva, when did it become apparent to you that you were injured?
Like when I heard somebody scream out, he's got a knife, he's got a knife.
So when you heard that, what triggered in your head?
I was just like, he's like, I just heard that and I was like, he's got a knife. Like, who's hurt? Like, is everybody okay? I didn't even realize I was hurt or anything. And then my buddy Ty Wood came up to me and was like, are you okay? Like, you're bleeding. And he pointed down at my side, and I had bled through all my clothing.
And when you realized that you were bleeding, what did you do?
I like lifted up my shirt and I wanted to see like what was wrong with me. I didn't know what had happened. I didn't know how many times I had been stabbed or anything like that. And like right at the same time I'm realizing I had gotten stabbed, I hear all the bubbles and like my lung collapsing basically, and like bubbles in my chest. It was a really weird sound. I don't know how to describe it. I never want to hear that sound ever again. It kind of like it like haunts me in a way. But I just got super scared and I didn't know what was gonna happen.
Were you able to breathe?
Barely.
And when you realized that you were injured, what did you do next?
I went inside and I just wanted to sit down and get a glass of water. That's all I could think of was sit down, get a glass of water.
And did somebody bring you a glass of water?
Yes.
And do you recall who that was? Why don't you recall it?
I just was in such like a fog of like mentally, all I could think of was just like one breath at a time, pretty much.
At some point in time, did somebody come in the house to get you and bring you outside?
Yeah.
Do you recall who that was?
No,
And at some point in time, did you exit the house?
Yeah.
Why did you exit the house?
because the ambulances were arriving.
And when the ambulances arrived, did somebody render aid to you?
Yeah.
Okay. And what did they do for you when you were on scene?
They just were asking me my injuries and what was wrong, and I just had to explain to the best I could what I felt.
And were you taken to the hospital?
Yes.
So I'm going to show you. We started doing this yesterday. So State's Exhibit 61. This individual here on the left, you know who that is?
Yeah.
Who is that?
Ricky Fiola.
You got the white
Ricky.
picture on the left side of 61 there. Exhibit 62. Do you know who this individual is?
That's the defendant.
Exhibit 63. I'm going to point this kid here to the left. He appears to be a green sweatshirt, black shorts with white trim. Who's that?
That's me.
This kid here with the white shirt and black shorts next to you. Who's
Sal Perry.
the kid next to him with jeans on with the no shirt on? You know who that is?
Alex.
Alex Bernstein?
Yeah.
This guy here with the jeans on, the black shirt, and the red hat, you know who that is?
Yeah, Michael Samberry.
And this guy here on his knees with what appears to be a shirt pulled up with jeans on, you know who that is?
Yeah, Jack Silva.
Who's that?
Tyler Silva, I mean.
64. This guy right here to the right, the white shirt, black shorts on, do you know who that is?
That's Charlie
Charlie who?
Connery.
Again, 65. Charlie Connery?
Yeah.
66. This guy right here with the white shirt, appears to be tan shorts next to you.
Yeah.
You know who that is?
That's Jake Villalobos, right?
This guy right here with the shirt off, with the camouflage pants on, with the shirt hanging out the back, do you know who that is?
Yeah, that's Matt Lockovich.
And this individual right here with the navy blue shirt, white pants, you know who that is?
That's Jimmy McGrath.
67. This individual who appears to be pushing somebody to the picture, do you know who that is?
Jake Villalobos.
And this individual here with the navy blue shirt, white pants.
Jimmy McGrath.
768, this individual with the jeans, appears to be a shirt still pulled up, with their back to us, do you know who that is?
Tyler Silva.
And this individual to his left, do you know who that is?
That's the defendant.
Finally, state 69, this individual appears to be near the curb in the street with the light blue jersey on, you know who that is?
That's De Silva.
And this person here with the navy blue shirt on, white pants,
That's Jimmy.
Jimmy McGrath?
Yep.
Now, at some point in time, when paramedics came and rendered aid to you, do you recall whether or not you took your shirt off at the scene?
I think I did take my shirt off. I think I was using it to like cover up my stab wound.
I'll show you state's exhibits 25, which is the full exhibit. These,
There might be
items
oogie
wearing
pictures.
tonight, May 14th of 2022.
Yes.
Appears to, the black shirt, does that appear to be inside out?
Yeah.
State's exhibit 26. Is that the same shirt with right side in?
Yep.
And obviously the green sweatshirt, is that yours?
I don't know whose shoes those are.
Those are not your shoes.
Those are not my shoes.
Exhibit 27, closer up picture of the shirt that you were wearing that night.
Mhm.
Let me approach the witness, Your Honor.
You may.
Ryan, you see this defect in the shirt here?
Yeah.
Is that about where your upper stab wound was?
Yes.
And is obviously, is this the front of the t-shirt?
Yes.
Exhibit 28. Closer version of the t-shirt. Again, is this the defect in the shirt? Is this where one of the stab wounds was?
Yes.
Exhibit 29. Is this your sweatshirt with the defect in it from the stab wound?
Yes, it is.
Okay, first the witness, Your Honor.
Of course, thank you.
Brian, I'm going to show you states 83. That's now been marked as a full exhibit. Again, what is states 83?
Me in the hospital.
Now, these injuries to you, point out, it looks like it appears you have injuries to your nose, your face area, and your head. Were those injuries caused during the fight at 43 Laurel Glen?
No, those were at Lazy Brook.
So when you got into the initial fight at Lazy Brook with the defendant and his friends, that's when that happened?
Yeah.
States 84. This injury here to the top of your head, which looks like the left side of your head.
Mhm.
Do you know when that injury occurred?
That's from Lazy Brook as well.
That's also from Lazy Brook, okay. States 85. Can you tell us where States 85 was from?
That's the tube that had to be put in my chest
Do you know why the tube had to be put in your chest at the hospital?
to reinflate my lung.
States 86. What are we looking at in States 86?
So the gauze is where I was stabbed, and then that is part of the tube that was coming out of my chest.
And this, obviously, this is the left side of your chest,
Yes, sir.
and that's where you got your injuries?
Yeah, on my left side.
States 87. Can you tell us what States 87 is?
That would be my stab wound to my upper chest.
And this is the stab wound that caused the collapsed lung?
Yes, it is.
States 88. Can you tell us what we're looking at in States 88?
That is my stab wound to my hip.
You're around here?
Yeah.
Right. And this is the tube?
Yeah, that's the same tube.
States 89. Is this the same wound but uncovered?
Yes.
This is what, a few days after?
Yeah.
That's pretty sizable to not
It's nice.
really pay attention
What are
to.
we looking at here? This is what?
That would be my stab wound to like my lower butt cheek, pretty much.
So like the hip area?
Yeah,
And again, this tube that's running down, where's that coming from?
that's the same tube that was in my chest.
91. Is this the same wound you just mentioned but uncovered?
Yes, it is.
Showing you states 92. So it appears to be the right side of your body, but are these injuries on the right side of your body?
No, they're on my left side.
So is this picture being taken in a mirror?
Yes.
Okay, so this would be your upper left chest area where the first stab wound was.
Mhm.
Second stab wound to your lower abdomen area.
Yep.
And then your third stab wound would be on the left side of your hip.
Yes.
And when were these pictures taken? Do you know?
A couple weeks after.
Now, after you were at the hospital How long did you stay in the hospital for? You remember?
I was there for 2 nights and 3 days.
And
Did he just say those were on the left side of his body? Is that right? Okay, yeah. Sorry.
do you recall what you were diagnosed with?
A collapsed lung. I believe I had a fracture in my nose, and some head trauma, and I don't remember everything else.
And what was the treatment that, aside from getting to the hospital and initially getting diagnosed, what treatment did you have to go through?
Well, I couldn't get stitches because they didn't want my wounds to get infected, so it was really cleaning them out multiple times a day, keeping fresh gauze on them at all times, and just a lot of rest.
And what has your recovery been like?
Physically, they healed up, but mentally, I've never been the same person.
What was that?
I can't stop thinking about that night. Like every single day, multiple times a day, I just think about that night and things that I could have done different, things that anybody could have done different, and I just didn't think things like this happen in the world. I don't know. I didn't know there was people like that out there that really wanted to cause harm.
When you were at Laurel Glen that night and those individuals walked on the front lawn and the fight started, did you anticipate the fight being a fist fight?
Yes.
Did you anticipate there ever being any weapons used?
No.
Did you have any weapons at Lazy Brook that night?
No.
Did you have any weapons with you at Laurel Glen that night?
No.
Did Ty Wood have any weapons on him?
No.
Did anybody near you, did you recall anybody near you when you were face to face with the defendant having any weapons?
No.
No further questions, Your Honor. Thank you.
Attorney Smith.
Thank you. Morning, Mr. Hance.
We're going.
We have
All
never
right.
met before.
Let's get
Never
to the
talked about
bottom
this
of
case
this,
before.
Kevin.
Let me go over with you some of your testimony that you've given here. You told us yesterday you thought you'd met with the state's attorney 3 or 4 times prior to this.
Yep.
To discuss your testimony here.
Yes.
Do you recall that?
Mr. Hines, I am going to ask you just to please keep your voice up, okay?
Yes, sir.
Thank you.
And when you're answering, you just have to say either yes or no. The court reporter can't get a on the record, okay?
All right.
Thank
you. Okay. So let's review that evening. You told us that Griffin Marcinzik was a really good friend of yours since childhood, basically, right?
No, I moved to Shelton in the winter of when I was in 8th grade. So right about when COVID started, I moved to Shelton, but Griffin was one of the first kids I met and I became very good friends with him.
Okay. So good friends since you moved to Shelton.
Yes.
You say that was in the 8th grade.
Mhm.
And at this time, May 14th, 2022, you told us that you were ending your sophomore year. So you would have been a rising junior.
Yes.
And you went over to a friend's house. Was that Natalia Ritzik's house?
Yes.
And you hung out there at Natalia's, right?
Yep.
You told us that you were doing some drinking there while you were hanging out.
Yes.
And that was, you had no more than 2 beers, right?
No more than 2 beers.
How do you know no more than 2?
Because I know it was no more than 2 beers.
What makes you so certain about that? No more than 2.
Because it was only 2 beers.
And that was only in 30 to 40 minutes of being there that you had those 2 beers?
Yes.
Power drinking that night?
I'm sorry?
Was that power drinking? Was that
I'm not-
fast
I'm
for you,
not
or was
sure
that a fairly regular speed to have 2 beers in a 30 to 40 minute period?
That's pretty normal.
And
What?
then you told us that you got invited over to Austin Leifer's house, right?
Yes.
How did you know Austin?
I met him in 8th grade when I moved to Shelton.
Also when you moved to Shelton.
Yes.
Did Austin go to Shelton High School?
No, he didn't.
Was Austin on the basketball group text chat?
I don't recall.
And Tanner Chernowski drove you to Austin's house, right?
Yes.
How did Tanner Chernowski know to take you to Austin Leifer's house?
Me and Griffin asked him.
And who is Tanner Chernowski to you?
Another guy that I met when I first moved to Shelton and became a really good friend of mine. He happens to live not too far from me and hang out.
Did you play football with Tanner?
No.
You played football with Griffin?
Yes.
Did you play any sports with Tanner?
No.
He was a couple years older than you?
Yes.
Did Tanner Chernowski provide you with any of those beers that evening?
No.
And you said that he drove you over to 5 Lazy Brook, and that was somewhere between 7 or 8 o'clock, right?
Yes.
And that you got there to the house while it was still daylight, but by the time you left, you would agree it was no longer daylight, right?
It was like the evening time. Yes.
Because we've seen the video of the fight outside of 5 Lazy Brook, and it appears to be pretty dark then. Are you saying that at that point there was still some daylight?
Yes, there was still some daylight.
And when you showed up, you heard music and noise, and you thought that was a party, so you walked into the garage, right?
Yes.
And at that point, you still only had the 2 beers?
Yes.
But you didn't make it into the house, is that fair to say?
Yes.
You just got into the garage?
Yeah.
And how many people were in the garage when you got in there?
I don't think anybody was in there.
Nobody in the garage?
No.
So as you're going from the garage to the door into the interior of the house, you see some people coming out of the house, right?
Yes.
And in fact, you came to learn that the party was being shut down or something of that nature, right?
Not really that. I just found out after the fact that the people that were coming out that I saw were happening to be getting kicked out at the time.
Okay. This wasn't your party, right?
No.
And so you saw some people coming out of the house, but you don't know why they were coming out of the house?
No.
In fact, some people thought you hadn't been invited to the party, right?
I'm not sure.
Well, you were confronted by some folks who said they didn't know what you were doing there, right?
Yeah, but the homeowner invited me and Griffin.
Well, not the homeowner, right? Austin doesn't own
Homeowner's
the
son.
home, does he, right? And in fact, Madigan was having a party, right?
I'm not sure.
Well, did you see a number of girls there that evening?
Yes.
You caught a ride with some of those girls at the end of the evening?
Yeah.
Did you know that they were all members of the lacrosse team from that school?
No.
Okay. And you never saw Austin that night, right?
No.
Because he was outside throwing up and ill from drinking, right?
Objection. How do you know?
Sustained. So hold on a minute, Attorney Smith. Ladies and gentlemen, the jury court's going to strike the the witness's response to that particular question. And I'm going to ask you to not consider the question, and you'll learn that questions are not evidence, okay? So the stricken response,
Whoop.
not evidence, not to be considered. You'll hear more about stricken evidence at the end of the evidence. And the question obviously is.
Yeah,
not
but
to
we
be
know what
considered
the
evidence.
story
Thank
is. So Austin was puking
didn't see
because he
Austin
drank
that
too
night,
much. Hmm.
And these three folks that come out the door, you say that they confronted you about coming there, prevented you from going inside, right?
Yes.
And ultimately, you claim that they didn't care about that, right?
What do you mean?
Well, you said they didn't care that you told them that you had been invited.
Yes.
And Mr. Valle, you told us, didn't say anything to you, right?
No, he was speaking to Griffin.
It was Mr. Snyder who was having this interaction with you, right?
Yes.
And you saw him on that photo and identified him as wearing that red hoodie that evening, correct? And in fact, you say that Mr. Snyder asked you for a beer and you told him, yeah, sure, right?
Mhm.
You gave him a beer.
Yes.
And you said that Mr. Valle asked you if he could have a beer and you said, yeah, sure.
Yeah.
And you gave him a beer, right?
Just trying to be a peacemaker.
You gave both of them a beer that night, correct?
Yes.
Griffin Marcinzik was right there when that happened?
Yes.
Were you blocking his view so that he couldn't see you give the beers to these two people?
Griffin?
Yes.
I'm not sure.
Do you recall where Griffin was?
I believe he was right next to me.
And that wasn't enough for Mr. Snyder, right? He
No.
decided he was going to grab those beers from you.
Yes.
Mr. Valle didn't grab the beers from you.
No.
Mr. De Silva, did you see him?
Yes.
He didn't say anything to you.
No.
He didn't grab the beers from you.
No.
Ultimately, Snyder grabs the beers from you. You said you were trying to be cool and make some friends.
Yes.
And at that point, you got upset with Snyder, right?
Yes.
He said you weren't going to stand for this, right?
Yes.
You were upset at that point,
I
right?
was. I wasn't going to get pushed out and bullied.
You said, I'll fight you right now for this beer, right?
Yes, I did.
And you put your hands up to fight.
Yes.
And y'all make it out into the driveway from the garage, right?
Mhm.
And we saw the video there.
Yes.
And in that video, we see you and Mr. Snyder squared up, right?
Yes.
And you're circling a little bit for position, right? It's a fight going on.
Yeah.
Right? You're not just standing there toe to toe like we see some old school bare knuckle boxers, right? You're moving around. You're circling.
A little bit, yes.
You bump into Mr. Valle?
No.
No, you
No.
don't bump into Mr.
No,
Valle.
I do not bump into Mr. Valle.
Where was Mr. Valle?
He was hiding behind me.
Hiding behind you?
You could say that, yes.
Hiding behind what?
Me. Just he was behind me. I
He
didn't know
was
he
just
was there.
behind you,
Yeah,
right? He
he was-
wasn't hiding. You were aware he was there.
No.
You knew there was a circle of people around you watching, correct?
Yes.
And you were circling for position.
No.
You were just going to stand still and let Mr. Snyder come towards you.
I wouldn't really say it was circling, but it was more of just like a little like get a better position. You could say that, yeah.
You're not just going to stand still and let somebody who you've just challenged to a fight just come at you and start throwing blows, right?
Well, in all honesty, that was my first fight ever that night. I never had been in a fight before that, so I very well could have been standing right there. I don't have a fighting background.
Okay. But you saw the video.
Yes,
You'd agree you were moving,
a little bit, yes.
right? You weren't just standing there. And you told us that Mr. Valle comes out and he sucker punches you, right?
Yes.
He didn't tackle you.
No,
He didn't throw any more blows than that, correct?
not that I'm aware of, no.
In fact, he moves away from you and gives more space after this interaction, right?
What interaction?
The interaction where you say he sucker punched you.
Yeah.
At that point, you come forward and you tackle Mr. Snyder, right?
Yes.
Get him down on the ground, right?
Mhm.
You go off the screen, right? We can't see the rest of that as you guys are sort of behind a minivan. And at that point, people come in and they're trying to break it up, right?
No, not really.
No?
No.
Well, did you see Emily Robinson in that video coming in?
I don't know who that is.
Did you see any of the girls that were there coming in?
No.
Did you hear any of them?
No.
fair to say your attention was focused on Mr. Snyder?
Yes.
Okay. And Mr. Valle, he had this helmet on, correct?
Yes.
He had that helmet on the whole time, right?
No,
No, you believe he took that helmet off?
he did take the helmet off.
You believe he took that helmet off?
I see it in the video. Yes.
In the video, you see him take the helmet off?
Yes.
And what does he do with it?
He smashes me in the back of the head with it.
And then what does he do with it?
Hits me again in the back of the head with it.
And then what does he do with it?
Not sure.
Does he put it back on?
I don't know.
So it's your testimony, sir, that he takes the helmet off of his head,
Mhm.
swings it at you, and hits you with it twice.
Yes.
And then you're not sure if he puts it back on or not.
No, the video is over.
What does that have to do with anything? What do you remember?
And ultimately, somebody pulls you by the neck up off the ground, you said?
Yes.
So you would agree somebody was trying to break this thing up?
Yes.
Do you know who it was that pulled you off? And at that point, you said, Mama Lifer gave you your beer back?
Yes.
And you guys took off, right?
Yep.
You and Griffin went down to the end of the driveway, and you got a ride from the girls that we saw in the photograph later,
Yes.
right? And it appeared that a number of the folks in there, including yourself, were holding blue cans of Bud Light. Do you
Yes.
recall that?
Yes.
Would you agree that you were holding a blue can of Bud Light?
I believe I had the box in my hand.
Okay. A number of the girls were holding what appeared to be blue cans of Bud Light. Correct?
Yeah.
So y'all were drinking in the car on the way back to where you went, which was back to Ms. Ritzik's house?
I don't recall if I was.
There was drinking going on in the car.
I'm sure.
You
Yes.
can see that at least.
I don't know.
Well, you gave them those Bud Lights, right?
I don't recall.
That's the oddest I don't recall right there.
In any event, you got back to Natalia's house.
Yes.
They dropped you off there.
Yes.
You do recall that?
Them dropping us off there?
Yes.
Yes.
And you were there for about 10 minutes before you got picked up by Charlie Connery, right?
Yes.
How did Charlie Connery know to come and pick you up from Natalia Ritzik's
I
house?
don't know.
You don't know.
I don't know.
Well, you told us that about a week earlier you'd been added to the basketball group chat, right?
Yes.
And that basketball group chat, that included Griffin Marcinzik, right?
Yes.
Did that include Tanner Chernowski?
I don't know.
Did it include Sal Perry,
I don't know.
Michael Samperry?
I don't know.
Did it include Alex Bernstein?
I don't know.
Did it include Tanner Chernowski?
I don't know.
You don't know anybody that was included on this group chat that you got added to.
I didn't know anybody in that group chat other than a few of my Shelton friends.
Oh, okay. Well, which of your Shelton friends did you know in that group
Just
chat?
ones that weren't involved in anything.
Like who?
Like Michael Kinnick, for example.
That's the only one of your friends that you knew that was in that?
Yeah.
How many people were on that group chat?
I don't know.
10?
I don't know.
15?
Don't know.
20?
Objection, asked and answered. He doesn't know.
Don't know.
Sustained.
You have no idea how many people were on that basketball group chat.
No.
Objection.
That you told us was about a lot of shit talking, right?
Yeah.
But you don't know anybody that was on it.
No.
Sustained.
Wouldn't we like to have those records? Maybe that'll come up in the next trial.
And somehow, Charlie Connery knew to come pick you up at Natalia Ritzik's and take you over to Tyler Rich's house, right? Had you had plans that night to go to Tyler Rich's house already?
No.
And along the way, you told Charlie Connery about what had happened at 5 Lazy Brook, right?
He already had known.
How did he already know?
I don't
Objection,
know.
how do you know? Speculation.
Sustained. Again. All right, so Mr. Hines, I'm going to ask you to just pause in between the questions so counsel can go forward with his objection. So once he objects, please refrain from providing an answer. Okay, thank you so much.
Sorry.
And again, direction to the jury, the last response should be stricken from evidence. Thank you.
You say he already knew when he came to pick you up about the fight at 5 Lazy Brook.
Yes.
How did you know that he already knew?
Because he asked me about it.
He asked you about the fight at 5 Lazy Brook.
Mhm.
And based upon that question, you determined he already knew about it.
Yes.
And how long did it take you to get over to Tyler Rich's house?
Another 10 minutes.
Any drinking along the way?
Not that I recall. No.
And you told us yesterday that you weren't involved on that group chat, right?
No.
But then you told us today that in fact, maybe you had sent a message, just one message, right?
Yes.
What was that message?
Saying that they were pussies for jumping me at the Lifer household.
And to come to 43 Laurel Glen Drive, right?
No.
You didn't send out the address?
No.
But somebody did, didn't they?
I believe so. Yes.
On that group chat, right?
I would assume so. Yes.
Well, you
Mm.
wouldn't assume so. You told us you were aware of that group chat. It was going off and it was buzzing in your pocket when you told us yesterday, right?
Yes.
And you would look at it from time to time and just say, oh, that's nothing. I'm not worried about that, right?
Yes.
Except today you told us, in fact, no, you had been involved. You would agree that's different than just looking at it and ignoring it, right?
This is before, like, I was at the Rich's house. I was not sending any texts. This was all like before I even got picked up by Charlie.
Do you recall speaking to officers on May 15th at about noon when you were at St. Vincent's Hospital?
Slightly.
Officers Millington and Nugent came in and they talked to you while you were there, right?
Yes.
And you told them that your friends and you had reached out to the kids who jumped you and told them to come to Tyler Rich's house at 43 Laurel Glen Drive now that you had your friends with you, right?
I don't recall that. No.
You don't recall.
Pull up.
Do you generally, in your everyday speaking, say that you don't recall something?
Objection argumentative.
Sustained.
I like it.
Do you recall speaking to detectives on June 9th around 3:30 with your parents at your home, Detectives Ianati and Bango?
Somewhat, yes.
Do you recall telling them that someone from the Shelton High School group texted the St. Joe's kids and challenged them to show up at 43 Laurel Glen Drive?
I do recall that, yes.
You do recall that?
Yes.
So again, it's not that you were just feeling your phone buzz and thinking, gosh, I don't want to pay attention to this. I don't have any idea what's going on. You were aware of what was happening, right?
No.
Well, how were you not aware of what was happening?
Because I wasn't reading the text messages. I just saw the notifications.
Do y'all believe that? Because I don't.
But you texted on that same group chat, right?
Hours previously.
Hours previously.
Yeah.
Hours previously, you told these kids that they were pussies, correct?
Yes.
On this group chat,
Yes.
correct? What time was that?
Around like 8 or 9 o'clock.
What?
So at least around 8 or 9 o'clock, you knew that you could use that basketball group chat to text with these St. Joe's kids?
Yes.
Was that
So would it
before the
surprise
first
you
fight or after?
If you learned that those kids weren't added to that group chat until after 5 Lazy Brook?
I'm not sure. What do you mean by that?
You're telling us that you texted these kids using this basketball group chat between 8 to 9 o'clock, right?
I believe so, yes.
Told them that they were pussies, right?
Yes.
But you didn't tell them to come to 43 Laurel Glen Drive because now you had your friends with you.
I did not tell them that, no.
You didn't tell them
I
that,
did not.
or you don't recall
I
telling
did
them that.
not tell them that, no.
Oh, that one you
Did somebody
remember.
tell them that?
Objection.
You know somebody told them that, right? You were part of that group chat. You had to open it up and text on that group chat, right?
Object.
Sustained.
Asked and answered. Any
Sustained.
speculation?
So you would agree that when you texted on that group chat, you would have to open it up. You couldn't just look at the notification, right?
No, you can just look at the notification.
In order to text something back,
I wasn't texting anything back
you were texting on that group chat, right?
beforehand.
And in order to text on the group chat, you had to open the group chat, right?
Yes.
And you were with Griffin Marcinzik, right?
Yes.
And you could see where Griffin Marcinzik was, right?
When?
When he was with you in the car?
Yes.
When he was with you at the Ridzik house?
Yes.
When he was with you when Charlie Connery came to pick you up?
Yes.
You were side by side most of the time, right?
No.
Not in the car?
No.
Where was Griffin in the car?
Which car?
Well, where was Griffin in Charlie Connery's car?
I don't know.
Where were you?
In the back seat.
You couldn't see Griffin texting?
No.
Did you see him with his phone out?
Yes.
Did you see him with his phone open?
I don't know.
You don't know.
No.
You think he just had his phone out in his hand, but you saw that, but you don't know if it was open or not.
I'm not sure. No.
What did you see him doing with the phone when you saw him with it?
I don't know.
What were y'all talking about on the way there
Just what had happened.
with Charlie?
Like in Charlie's car?
Yes.
Yeah.
So it's you, Charlie, and Griffin in the car, right?
Yes.
And you guys are talking about what happened at 5 Lazy Brook?
Objection. Asked and answered.
Yes.
I'll allow it. Go ahead.
And you're talking about what is going to happen next when you get to Tyler Rich's house, right?
No.
And there's no talk about payback or anything like that, right?
Oh, of course not. No, no vengeance. That doesn't happen with young teenage
And so
males.
there's this basketball group chat that you've now told us you actually did participate in which there's a lot of shit talking, but nothing's going on like that on the way to the house in Charlie Connery's car, right?
No.
You guys are just calm, cool, collected,
Yes.
not excited,
No.
not angry about what happened.
No.
Nobody's saying, hey, we should text these kids and get them to come over here.
I was not. No.
You weren't.
I was not.
Was Griffin?
Objection. That calls for hearsay.
Sustained.
And you told us yesterday that when you got to Tyler Rich's house, everybody already knew about what had happened at 5 Lazy Brook, right?
Yes.
How many people were there when you got to the house?
20 or 30.
You told us yesterday you didn't really care though, right?
No.
You didn't really care. Why did you text these guys and tell them that they were pussies?
Because I had been jumped.
So you did care.
I've been jumped.
You did care.
Not really. No.
Not really. Didn't anger you?
No.
Didn't upset you? Didn't make you
Sir.
want payback?
No.
You went to school with Tyler Rich?
Yes.
You played football with Tyler Rich?
Yes.
He was a couple years older than you?
Yes.
And he was the captain of the football team for 1 year while you were there?
Yes.
You'd been to his house before?
Yes.
You knew to go in through the Bilko doors on the side, right?
Yes.
You knew when you got there that there was going to be some drinking going on?
Yes.
And you said that people were coming up to you and questioning you, and they already knew about what had happened, right?
Yes.
Who came up to you and questioned you about it?
I don't recall.
Well, you told us yesterday Jimmy McGrath was one of the first ones to come up to you, right?
He was one of the people that did come up to me.
And he came up to you and asked you about what happened in Five Lazy Brook, right?
Yes.
And he was interested in what had happened in Five Lazy Brook, right?
I think that calls for speculation.
Sustained.
Did his demeanor and his questioning indicate to you that he was interested in what had happened at Five Lazy Brook?
Yes.
Did it indicate to you that he was concerned about what had happened at Five Lazy Brook?
No.
He wasn't concerned.
No, he just wanted to hear what happened.
So it didn't indicate to you that he was excited in any way about it?
No.
Didn't indicate in any way that he was upset about it?
No.
Didn't indicate in any way to you that he was angry about it?
No.
It's just calm, cool, collected. First thing he asked you was, hey, what happened at Five Lazy Brook?
Pretty much calls for hearsay.
I'll allow it.
Do you remember anybody other than Jimmy McGrath coming up to you and asking you about it?
No.
But everybody there already knew, you told us, right?
Yes.
So you would agree that it was more than just Jimmy McGrath that came up to you and asked you about it, right?
Certainly, yes.
And in fact, there was some conversation that occurred, right? With everybody that was there yesterday. Conversation, hanging out, people drinking.
Yes.
And one of the main topics of conversation was what had happened to you at Five Lazy Brook.
Yes.
You told us you only drank one beer at that time, right?
Yes.
How do you know it was only one beer?
Because it was only one beer.
You recall that?
Yes.
And people were
No.
planning to reach out to these kids and ask them to come over to 43 Laurel Glen Drive, right?
I believe so.
You know so, right? Because your phone's buzzing and going off and people are talking about it. And
Right.
there's talk about getting these kids over there, isn't there?
I'm not sure.
He's just as evasive as everybody else, but he's just a
And at
little
one point,
better at
Griffin
it.
Marcinzik texts the address and a picture of 43 Laurel Glen Drive on this group chat to these kids, correct?
I don't know.
And then you told us at some point a car shows up outside, right?
Yes.
And that car is a Honda Pilot, right?
Yes.
And nobody was surprised by that, were they?
Not that I'm aware of.
No, they knew that car was going to show up. They texted it to come there, right?
Objection. That's
Sustained.
And so because nobody is surprised, everybody empties out of the house to go confront the car, right?
No.
How many people emptied out of the house to go confront the car?
I don't know.
So you told us yesterday that at least 10 to 15 approached the vehicle, right?
Yes, but that's not everybody.
No, that's about half of you, isn't it?
Somewhat, yes.
And you could be wrong about 10 to 15. You would agree?
Yeah.
Could have been more. Could have been 20.
Could have been less.
Could it have been more?
I don't know.
Oof.
And you told us yesterday that the car parked right in front of the drive, right?
No, it was not exactly right in front of the driveway, but it was a little farther back. It was about halfway in front of the driveway.
Mr. Hines, I'm just going to come around you. I don't want to surprise you, but I'm going to come around and put this up on the easel behind you. It's exhibit number 52, state's exhibit number 52.
Yeah. No.
I'm trying not to drop it today. And if you would, can you show us where that vehicle parked when it showed up that first time?
It's not in that frame.
It's not in that frame.
No.
So it's not that close to the driveway.
It was back here more.
Okay.
It's over here.
We are going to use state's exhibit 49. Just move all these off. Big step. Can you see state's exhibit 49 on your screen there?
Yep.
Okay. Looking at that, do you see the driveway in front of 43 Lower Glen?
Yes, I do.
Do you see the what looks like some sort of pathway down to the house across the street?
Yes.
And do you see the corner of the intersection of Adams and Lower Glen Drive?
Yes, I do.
And do you see what appears to be a sewer or drainage grate there?
Yes.
Okay. And do you see across the street on the other side of Laurel Glen from 43, sort of area of large trees there?
Yes.
Okay. Now that we've oriented ourselves, can you describe for us where that vehicle parked when it first showed?
More near the bushes across the street.
More near these, would you agree maybe these are trees given their apparent height?
Yes.
So you think that the vehicle parked more near trees on the opposite side of Laurel Glen Drive?
Yeah.
And so in relation to the driveway, you would agree that that is not near the driveway?
It was like that general area.
It's somewhere over there, closer to the curb on that side of the street?
Oh, no, they were in the middle of the road.
They're in the middle of the road.
Yes.
There were other cars parked up and down the street as well, correct?
Yes.
All right, so now we've got the vehicle out there, and you told us that 10 to 15 of you approached the vehicle, correct?
Yes.
And in fact, when you got right next to the vehicle, you didn't talk to anyone, right?
No.
But you noticed that in fact, these were the kids that had been told on the basketball group chat to come to 43 Laurel Glen Drive, right?
Objection.
Sustained.
You noticed that these were Mr. Snyder, Mr. De Silva, and Mr. Valle in the car, you told us, right?
Yes.
Those were the kids from 5 Lazy Brook, correct?
Yes.
And these were therefore the kids that had been told to come to 43 Laurel Glen Drive, correct?
Objection.
Sustained.
Again, it didn't surprise you that those kids had showed up, right?
I'm not sure. I don't remember.
You don't remember whether or not you were surprised that they showed up?
No.
Then you just tell us moments ago that you weren't
Wow.
surprised?
Keep going, Kevin. You're wearing
And
him
the car was
down.
facing towards Farmhouse Lane, correct?
Keep going.
That's at the other end of the street, right?
That is at the other end of the street, yes. And you noticed the three that I've just mentioned, as well as Mackenzie Trafficante.
Yes.
How did you know Mackenzie?
I just knew who she was from social media.
And you said 10 or 15 of you approached the vehicle and someone had a conversation, right?
Yes.
And you were standing right beside the vehicle, correct?
Yes.
And you were on the driver's side of the vehicle, correct?
Yeah, I was kind of going back and forth,
When you say back and forth between what 2 points?
like the driver's side and the passenger side.
So you were going back and forth around the vehicle from one side to the other?
Yeah.
Behind the vehicle or in front of the vehicle?
I don't recall.
Was anybody else going back and forth with you?
I don't know.
Who else was there at the vehicle with you?
I don't know.
You don't know any of the other people that were at the vehicle with you?
No.
Did you see Tyler Rich there?
No.
Did you see Faison Teal there?
No.
Did you see Michael Samperry there?
No.
Did you see Sal Perry there?
No.
Did you see Alex Bernstein there?
No.
Did you see Matthew Lokovich there?
No.
Did you see Tanner Chernowski there?
No.
You didn't see Tyler Rich there?
No.
So there were
What
10 or 15
in
of you
the
there,
world?
and these were all friends that you'd had and played football with at least since the 8th grade.
Yes.
But you can't tell who was there with you at the car.
No.
You heard voices.
Yes.
Whose voices did you hear?
I don't know.
You said you heard someone having a conversation. Who was that was having the conversation?
I don't know.
I hope he
Well, you said that
remembers
initially that
what I
conversation
don't
was
know
normal,
about
right?
Yes.
for the
When you
next
say
trial.
normal, what do you mean by normal conversation?
Like the one me and you are having right now.
Okay. So it was just a questioning back and forth. Hey, how you doing?
Yes.
Okay. Do you remember any mention of McDonald's?
No.
You didn't think this was an Uber that had showed up to deliver something, right? And you can't tell us who was having this conversation, but it seemed to be a normal conversation. Is that fair to say?
Yes.
Right. And then you said, then it became aggressive, right?
Yes.
It didn't just get aggressive, right?
What do you mean by that?
Somebody did something for it to become aggressive, for it to change, right?
I'm not sure.
Okay. Did you see Tyler Rich reach inside the front driver's side window?
No.
Did you see Tyler Rich put his body halfway into the front driver's side window?
No.
Did you see Aiden King at the car?
No.
Wow.
And then you told us that cans started getting thrown at the car, right?
Yes.
Again, sir, they didn't just start getting thrown, right?
Yes.
No, somebody threw something, right?
They threw a can. Yes.
Yes. It didn't just start from nothing, right?
I don't know.
But you
Spontaneously
described it
threw
as
itself.
cans just started getting thrown at the car.
From what I was aware of, yes, that's what had happened.
But then you told us that you threw a can at the car.
Yes, I did.
So it didn't just start getting thrown, you threw a can at the car.
I didn't start throwing the cans.
Okay, you joined in of the throwing of the cans.
Yes, I did.
You would agree that it was other people, not some anonymous entity that was throwing cans at the vehicle, right?
Yes.
And those people that were throwing cans at the vehicle were aggressive. Would you agree?
They were aggressive, you said?
Yes.
Sure.
That's an aggressive act, right?
Yeah.
What would you expect the response to be to a can being thrown?
I'm gonna object that closer.
Sustained.
What did you intend to happen when you threw the can at the car?
For my can to hit the car?
You wanted those kids to get out of the car, right?
No.
You heard somebody say, leave or get out.
No.
You didn't want them to get out of the car.
I didn't hear them say that. I didn't want them to get out of the car. I didn't care if they got out of the car.
You didn't want them to get out of the car. You didn't care if they got out of the car. So why'd you throw the can?
This is so apoplectic. I'm
I just want
like
to throw the can at the car.
losing my mind.
Is that a normal thing for you to want to do?
Oh,
Why
can
did
you
you want to
imagine
throw a can at that
parenting
car?
him?
I just saw other people doing it.
Do you
I'm with
generally
you,
just do
Kevin.
what you see other people doing, even if it's criminal?
No.
But in this instance, something about the occasion made you want to do that.
Yes.
What was it about the occasion that made you want to do that?
I don't know.
In any event, you threw a can and you hit the car.
Wow.
Other people were throwing cans too, right?
Yes.
Were you still circling around the vehicle while you did this?
No.
Where were you now?
I was on the passenger side.
On the passenger side?
Yes.
Who did you see on the passenger side?
I don't know.
How many other people were on the passenger side with you?
Maybe 5,
5 people on the passenger side?
maybe.
How many people were on the driver's side?
I don't know.
More people were on the other side, right?
I don't know.
Objection. Say no.
Sustained.
Could you see other people on the other side?
Yes.
So there were other people on the other side.
Yes.
You just don't know how many.
No.
Or you know, but you won't tell us.
I don't know how many.
Sustained.
You never saw Tyler Rich on the driver's side of the vehicle.
No.
You saw in the picture yesterday of the vehicle that it had a defect in the windshield, right?
Yes.
Did you see that when you were on the passenger side?
No.
You saw it in that video, in that picture though, didn't you?
Yes.
Did you hear glass shatter?
No.
And you didn't see anybody throw anything from that vehicle, did you?
Not that I recall, no.
You didn't see anybody put their hands on the vehicle?
No.
You didn't see anybody kick the vehicle?
No.
You didn't see anybody rock the vehicle?
No.
But at
This
some point you said the car pulled away and started driving back and forth really fast, right?
Yes.
But they weren't throwing anything out the windows.
this testimony
point,
has to be,
you were in the
turn a
driveway with
jury
us.
off.
Yes.
And who else was in the driveway with you?
I don't remember.
Were there other people in the driveway with you?
I'm sure there was.
Was Faison Teal in the driveway?
I don't know.
Was Tyler Ritz in the driveway?
I don't know.
Can you tell us anybody who was in the driveway with you?
No.
But you told us you were talking to the person that was next to you, right?
Yes.
Who was that?
I don't know.
I think it's pretty obvious what he's doing as a witness,
You
and
said
I
at some point
don't know that that
you
plays
do
well.
remember that the car stopped at the corner near Farmhouse Lane and Laurel Glen Drive, right?
Yes.
Where were you standing at that point?
When it stopped,
Yes.
I believe I was in the driveway still.
And you told us that you did remember that Tyler Rich at that point was running down the street after the car, right?
Yes.
Where had he been before he was running down the street after the car?
I don't know.
But you remember that he was running down the street after the car?
Yes.
Was anybody else with him?
There were some people. I don't know who they were, though.
How many?
2 or 3.
2 or 3? Okay. And you told us that you walked halfway down there by yourself, right?
Yes.
You weren't with Tyler Rich?
No.
You weren't with Faison Teal?
No.
You weren't with Enrique Fiola?
No.
And you said you were by the trees on the left-hand side of Laurel Glen, by pine trees just past 43 Laurel Glen Drive. Do you remember telling us that yesterday?
Yeah, like where the shade is in the picture.
But you weren't close enough to see what was going on, you told us.
No.
So at that point, you couldn't see Tyler Rich anymore?
No.
At that point, you couldn't see Faison Teal?
No.
Couldn't see Enrico Fiola?
No.
Did you see Charlie Connery?
No.
Did you see Mr. Valley?
No.
You didn't see Mr. Valley emerge from the bushes on the other side?
No.
Did you see anybody throwing anything at that point?
No.
Did you hear anybody saying anything at that point?
No.
Where was the vehicle now?
Still at the end of the road.
Still at the end of the road, so you could see the vehicle?
Yeah.
What was it doing?
Parked.
Were the doors open?
Yes.
So you could see that the doors were open.
Yes.
And did you see anybody come out of the car?
I believe so, yes.
Oh, you did?
Yeah.
Who?
I don't know.
And where was Tyler Rich at that point?
I believe down at the car.
And sir, do you recall telling officers on June 9th when you spoke to them at your home that in fact you, Enrico Fiola, and Tyler Rich approached and told them to leave?
No, I don't.
You don't recall telling that?
No.
Did you tell them that?
I don't
Wow.
recall saying that.
You're telling us now that you only walked halfway down there, right?
Yes.
And you weren't close enough to see what was going on?
No.
But you told us yesterday that people appeared to be talking.
Yes.
What was it about their appearance that led you to believe they were talking?
Like hand gestures, stuff like that. Just looked like they were having a conversation.
Civil conversation?
Yes.
Hand gestures like what?
Just normal hand gestures that you would say while you're having a conversation.
Didn't appear to be aggressive to you at that point?
No.
You didn't throw anything down there at that point?
No.
You were done throwing things?
Yes.
And you weren't upset anymore at that point?
No.
And you watched that for 30 seconds before you went back to the house, correct?
Yes.
Through the Bilko doors, correct?
Yes.
Back inside to Tyler Rich's?
Yes.
And you said when you got back there, everyone seemed to be in there then, right?
Yes.
Did they pass you, the group of folks that you had seen down at the end of Farmhouse Lane?
No.
How did everyone get back in before you got back into the basement?
Because I was halfway down the street and then not that many people walked there. Everybody just went inside.
Did you see Tyler Rich inside?
No.
Did you see Faison Teal inside?
No.
Did you see Matthew Lockovich inside?
No.
Did you see Alex Bernstein inside?
No.
Did you see Sal Perry inside?
No.
Did you see Michael St. Perry inside?
No.
Did you see
What?
Charlie Connery inside?
In
No.
the world.
Did you see Tommy Connery inside?
No.
Did you see Ty Wood inside?
No.
Who did you see inside?
I don't remember.
But everyone seemed to be in there.
Yes.
What is
all seem to
happening
be
right
calm.
now?
I don't remember.
Did they seem to be agitated in any way?
I don't remember.
What were they doing?
I don't remember. I just remember being in there and there's people in there.
So before, when everybody was in there and nobody had even arrived, everybody was interested in what had happened at Lazy Brook. You would agree?
Yes.
But now, after all of this commotion, everybody's back in the basement and you're telling us that nothing was going on. It was all just business as usual.
Yeah.
Was there any drinking going on?
I don't know.
And then you said you heard they're back, right?
Yes.
Who said they're back?
Shame
I don't know.
on you.
Whose voice was it?
I don't know.
Was it just one person?
I believe so.
And how did they say they're back?
They're back.
Just like that?
They're in the front yard. They're back. Just like that.
Just like, oh, they're in the front yard, they're back.
Yeah, pretty much.
Not excited or agitated in any way?
No.
Not, they're in the yard, let's go, they're back.
That's exactly
No,
how it
because you
was said.
said
You know it was.
Instantly, you were like, I'm gonna go see what it is, right?
Yeah.
What did you think it was gonna be?
I don't know.
You just were curious about what might be going on.
Yes.
So you decided, I'm gonna go out and just see what it is.
Yes.
Did you walk leisurely back to the front yard?
Yes, I did.
Didn't run?
No.
But you told the state's attorney that you were anticipating a fight in the front yard, right?
No.
You said you anticipated a fist fight when you talked to him.
No.
You don't recall telling him before that you anticipated a fist fight when he was asking you about whether or not there were weapons?
What
Were
is
you anticipating
going
a fist fight?
on?
I really wasn't.
I'm past outrage now. I'm entertained.
So the truth of the matter is when you walked out there,
Yeah.
you were anticipating a fight because you wanted payback for 5 Lazy Brook, right?
No, I just walked out there to see who was out there.
No, you wanted
Well, you heard
payback. We
they're
all
back,
know.
right?
Yes.
That's what drew your attention to going out there, right?
Yes.
You thought they're back meant you were going to see the kids in the pilot again, right?
Most likely, yes.
The kids that you had thrown the can at before, right?
Yeah.
But you didn't want payback.
No.
You weren't anticipating a fight.
No.
You didn't think, man, I've got 20 of my buddies from the Shelton High football team here. We got pretty good odds on our side.
No.
You were just curious.
Yes.
Sir, you are 100%.
You told us that you walked into the yard and you were
unbelievable.
somewhere behind the red bush, right?
Yes.
And you saw, well, first off, when you were somewhere behind the red bush, did you see Tommy Connery?
No.
He wasn't in that area with you?
No. I remember I was one of the first people that walked outside.
You were one of the first people that walked outside.
Yes.
When you walked outside, did you see Faison Teal?
No.
Did you see Tyler Rich?
No.
Who did you see when you walked outside?
The defendant in DeSilva.
That's it?
Yes.
So you were the first one outside.
One of, yes.
Well, who else was out there with you?
I don't know.
Well, how do you know you were one of?
Because I can remember I never made it, like I was inside the basement, but I never like left the area of like where the stairs were, like to lead back outside through the corridors. So when somebody said they're here, I was already right there, right by the stairs. So I was one of the first person that stepped up the stairs and walked outside.
I thought you told us before that you had gotten back, went inside his house, and you're in the basement, and everyone seemed to be in there.
They were all in there, and I was one of the
Hey.
last people in there.
So now you're saying you didn't get into the basement, you were still on the stairs.
No, I was in there. I was just next to the stairs, like at the bottom of the steps, you can say.
The person who said they're back, were they inside or
I
outside?
don't know.
And you came back up the stairs and you went and you stood behind the red bush and you just saw these two people in the yard.
Yes.
Do you see the exhibit behind you, sir?
Yes, I do.
Do you still have the pointer with the little red tip on it?
I do.
Okay. Can you show us where you saw the two individuals?
They were right about in this area.
Okay, so they're back by the red bush.
Yes.
Beside the black truck?
Yeah.
In front of the cement square?
Around there,
They look like
That's
they were
not
coming
where
into the
anybody
house.
else said they were.
I don't know.
That's the same path that people take to get to the Bilko doors, right?
Yes.
Where was Mr. De Silva?
He was behind the defendant.
Behind the defendant.
Yes.
Could you see him?
Yes.
So was he behind him to the side or directly behind him?
Behind him to the side.
Which side?
My right side. So
Because
it
you're
would've been-
facing the street.
Yes, I'm facing the street. So
So Mr. De Silva is on the side by the, what we've described before as Elgin blocks there that go along the side of the driveway.
yes.
And where was Mr. Valle?
In front of him and in like more like this area up here a little more.
Okay. So up close to the tree line.
Yeah.
And you were one of the first ones out, you told us.
Yes.
And you didn't see anything in Mr. De Silva's hands?
No.
Didn't see anything in Mr. Valle's hands?
No.
You didn't have a knife out that he was flashing around and saying, who wants some?
No.
In fact, he wasn't talking to you, right?
Who?
Mr. Valle.
About,
Well, he wasn't talking to you. He was asking, where's Aiden King, you told us.
well, he was talking to me, asking me where Aiden King was.
You thought he was asking you where Aiden King was?
Yes, he was.
Get your
Do you know
lies
Aiden
straight,
King?
Yes, I
sir.
do.
How do you know Aiden King?
Play football with him.
Do you know if he knows Mr. Valle?
Objection, Howard.
Sustained.
And you said that you interacted with them, right?
Yes.
And what did that interaction involve?
The defendant walked up with like his shirt up over his head, like trying to hide his face almost. And he was saying, where's Aiden King? Where's Aiden King? Where's Aiden King? Just repeatedly over and over again. And by this time it was me, Ty Wood, and Nikki DeJesus all next to each other. And we're like, don't worry about it. Like, it doesn't matter where he is. And I pulled the shirt off of his head and I was questioning him saying, like, what are you doing with that on your head? Why are you wearing a shirt on your head? You look
So you
stupid.
reached out and you put hands on Mr. Valle.
No, I just kind of like that. Because he had
No,
a shirt
he
up on his
did.
head, so I just pulled it down.
Shirt was on his head.
Yes.
You reached out and touched the shirt.
Yes.
But that's not you putting hands on Mr. Valle.
Not in a physical way, no.
You thought you were straightening his shirt out for him, making sure he looked okay.
Yeah, I mean, I never really seen people put their shirt up on their head like that before. I didn't know what he meant by it.
You don't touch
didn't tell
other
him
people,
up-
sir.
Aiden, I don't know where Aiden is.
Yeah, I did say that.
Oh, you did?
I don't know where Aiden is.
I thought you told him, don't worry about it. I'm right here.
Pretty much is.
So that's not, I don't know where Aiden is, right?
I said all of it, yes.
He said, I'm right here,
I believe so, yes.
indicating to him that you were the person he needed to deal with, right?
No. I was just the person in front of him.
The tip of the spear, so to speak.
What do you mean by that?
Well, you were the first one that was confronting him, right?
Yeah, he said.
And you told us that at this point, you know that you had been joined by at least two others that you've identified to us, right?
Yes.
And that was Ty Wood?
Yes.
And who was the other person?
Nikki DeJesus.
Can you show us on that exhibit behind you there where they were?
Right next to me.
Yes.
So like right in this area.
And there's now three of you at least.
Yes.
Was there anybody else out there?
Not that I know of, no.
So you think it was just the three of you and Mr. Valle?
Yes.
You weren't aware that other people had started to come out of the house?
No.
Could you hear other people?
No.
What was Mr. De Silva doing?
I don't know. He was kind of just standing behind and to the right. I wasn't really paying attention to him. Like after I took off the defendant's shirt off of his head, I was really just locked in, staring him right in the eyes. I wasn't worried about Mr. De Silva.
You were staring him right in the eyes?
Yes.
The demonic eyes.
And you say he had his own shirt up over his head before you reached out and pulled it down. Were you standing in such a way that you were blocking anybody else's view from seeing Mr. Valle?
Objection, How would he know?
Sustained.
He said after you pulled his shirt off of his head that he got crazy and started freaking out, right?
Yes.
Became very argumentative.
Yes.
Asked you, why'd you take his shirt off his head?
Yes.
Asked you, what are you doing touching me?
No.
That's what
He
I
took
would
a swing at
ask.
Mr. Valle?
No.
No?
No.
You didn't see him take a swing or flinch?
Oh, he was flinching the whole time.
He was flinching the whole time.
Yeah.
Because there were, by your account, 3 people that were facing him.
Yes.
Did you become aware at some point that there were more than just 3 of you out there?
No.
You never became aware that there was more than 3 of you out there?
Well, after I had gotten up from the altercation I had with the defendant.
You said that at least you, Nikki DeJesus, and Ty Wood are talking shit back and forth, right?
Yes.
And that lasted, you said, for 30 to 45 seconds.
Probably yes.
And you were challenging him to fight, right?
No.
What were you saying?
Of course you
Talk shit.
And that shit talk didn't involve any challenge to fight?
No, that's not like, no, that's not at all. None of us really were saying that at all. Nobody was saying.
The shit talk just involved what? Insulting his clothing?
Could say that, yes.
What is going on?
Did you ever feel anybody push against you from behind?
No.
But out of nowhere, Tyler Rich punches Mr. Valle in the face, right?
Yes.
Where did Tyler Rich come from?
I don't know.
You don't know. So at that point, you would agree it's not just 3 of you, it's at least now 4 of you that are fighting with Mr. Valle.
I'm not sure.
Well, there's you. Right?
Can you do
There's
math?
Ty Wood, right?
Well, I don't know if he was fighting.
Well, he was right there with you.
Doesn't mean he was fighting.
Okay. Fair enough. Nikki DeJesus was right there with you.
Yes.
And now Tyler Rich was right there with you as well.
No, he just came out of nowhere and punched him in the face.
You would agree he at least was now fighting Mr. Valle, right?
Not that I don't know.
He doesn't know
Well,
much.
You would at least agree that he punched him in the face out of nowhere, right?
Yes.
And so the 3 of you, Ty Wood, yourself, Nikki DeJesus, you were distracting Mr. Valle so that Ty Rich could punch him in the face.
No.
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 But after Tyler Rich punched him in the face, you backed off, right? And you're like, oh, Tyler Rich has got this.
No.
No. You went forward, you got on top of Mr. Valle, and you told us that you punched him at least twice in the face, right?
Yes.
In fact, people crowded forward at that point, right?
I'm not sure.
You're not sure.
I just know of my actions.
Well, some of that you
and
don't even know.
Your actions, at least, were that you punched him twice in the face, right?
Yes.
While he's down on the ground, right?
Yes.
You're over top of him, right?
Yes.
You got control of him, right?
No.
No. You don't have a hand full of shirt in one hand and a punch in the other? But you would agree you're at least over top of him,
Yes.
delivering these 2 blows.
Yes.
Only 2 blows.
Yes.
Nobody else has joined you in this attack.
Not that I know of, no.
Well, that's absolutely not true.
And the crowd didn't push forward.
I don't know what the crowd did.
The crowd didn't swarm around.
I don't know.
He thinks if he
heard screaming?
answers,
You heard yelling.
Yeah.
You heard somebody say, yes, sir.
No.
he thinks if he answers the questions and he's not heated or anything with it, and he says it very matter of factly, that this is going to play better for him. And it just makes him look like a complete jackwagon. I don't know that he understands that. This is unbelievable. I thought Mr. Smirky Smirk yesterday, Tyler Rich, was something else. But oh no, I was yet to see Mr. Hines here. Wow.
You saw it in the video at least?
Yeah.
That was Tanner Chernowski
Yes.
filming this, right?
Not the beginning of the fight. No, he got the end of the fight.
The video that we see, that was Tanner Chernowski who recorded it, right?
Yeah.
And he was recording that and yelling, yes, sir, right?
Yeah.
And that was sort of celebratory, right?
Objection.
Sustained.
You described to us that while you were on top of Mr. Valle punching him, his shoulder and his bicep were held back.
It seemed like that. Yeah.
What was holding it
I
back?
don't know.
He's exhausting.
And you could see his fist, right?
Yes.
And at some point, you got off of him and walked away, right?
Yeah.
After you felt the stick, right?
Yes.
And you said he wasn't trying to hit you in a certain spot.
No, he was just like, I just seen his fist like this, just going like this repeatedly over and over again.
Flailing wildly.
Yeah.
And your injuries, sir, start sort of at the middle of your body and make their way down into the backside.
So yeah, my first one is up more near my armpit, then one's down more by my hip, and then the other one is like my mid thigh.
Where was Tommy Connery at that point?
I don't know.
Didn't see Tommy Connery? Did you see other people punching or kicking Mr. Valle?
No. Did not.
It was just the two of you isolated.
Yes.
This doesn't make any
And
sense.
you told us that after you got off of him, you realized that Tyler DeSilva was in a fight, right?
Yes.
And that he was fighting with his own group of people, right?
Yes.
And how many people were fighting with him?
Looked like 2 or 3.
2 or 3?
Yeah.
And you did not engage with Tyler DeSilva, right?
No, I did not.
You didn't throw any punches or throw any kicks at Tyler DeSilva?
No.
The fight took a minute.
Around that, yeah.
Could have been more, maybe 2 or 3 minutes.
No, it was probably less.
Probably less. Less than a minute?
Yeah.
He said you only watched the fight with Tyler DeSilva, but you agree that other people were throwing punches and blows at Mr. DeSilva, right?
Yes.
Tommy Connery didn't come over and get involved and throw some blows at Mr. Valle.
Not that I'm aware of, no.
Didn't jump in the middle and separate you.
I don't remember that, no.
Did you see Charlie Connery?
No.
This is really outrageous testimony, I have to say. I'm
And it
completely
was when you heard
outraged.
he's got a knife that Ty Wood pointed out to you that you were bleeding, right?
Yes.
And where was Ty Wood at that point?
He was like right next to me,
And where were you?
right next to him.
And could you show us where that was on the exhibit behind you? Okay. So by that point, you had moved away from where you were originally when you started with Mr. Valle, correct? In fact, when this original interaction or confrontation occurs, it was where you've described as being by the red bush, over by the tree line and the black truck, right? How did you get from there over to by the tree where you've just pointed to?
I walked.
The fight itself with Mr. Valle, you say, all occurred over where the initial confrontation took place?
Yes.
I want to smack him. How did
And
you get there? I walked.
When you say you saw the defendant's fist clenched with something in it that you now believe was a knife, that was his right hand, correct?
Yeah, that's his right hand.
You told us when this started, it was just the three of you, Mr. DeJesus, yourself, and Mr. Wood, facing Mr. Valle, correct? At some point, Mr. Rich comes over and joins the three of you and throws this first punch, correct?
Yes.
Mr. Valle hadn't thrown any punches at that point?
No.
Hadn't shown you a knife at that point?
No.
Hadn't threatened you at that point?
You're absolutely right, Liz Proctor's divorce attorney. Mine has to be sky
And
high
you would
right now.
agree, would you not, that at least in the video, there are well more than 3 kids involved with fighting?
Fighting who?
Fighting with whoever's out there. There's more than 3 kids that are out there fighting, right?
I don't object. That's confusing.
Sustained.
You would agree that in the video, we see more than 3 kids on the video, correct?
Yeah.
That it was a chaotic scene, right?
Of course.
That people were rolling around and it was hard to tell who was where, right?
Sure, yeah.
And you never saw Jack Snyder leave the car, right?
The one that caused all this.
After you backed off of Raul Valle, you could see that he was still fighting with some of the other Shelton Knight kids, right?
Oh, I have no idea.
You don't recall any of that?
I don't know.
After you backed off of him, you don't recall anything about what else was going on with Mr. Valle? But you do recall that you saw Mr. De Silva fighting,
Yeah, like I got up and I immediately like turned around and I see what's going on with the silver.
and you just watched.
Yes.
Didn't throw any kicks.
No.
Didn't throw any punches.
No.
Didn't get involved in any way with. And that night you were wearing the green hoodie,
Yes.
black shorts, and the white trim.
Yes.
Other than Tyler Rich throwing the punch at Mr. Valle, can you tell us anybody else who threw a punch that night?
No.
You never saw Mr. Valle punch anybody?
No.
And it was only after you were standing over top of him, punching him, that you felt a stick in your side.
Yeah.
And your recollection is that it was just you and Mr. Valle fighting alone.
Yes.
Thank you, sir. Nothing further.
Attorney Joyce,
I do have some redirect. You want to take the morning recess at this
I
point?
think probably now is a good time to do that.
Woo. Oh my
And there were some
word.
questions about the group chat that had started. And my question to you is, at what point after the fight at Lazy Brook did you even participate in the group chat?
I really didn't. I think maybe in that car ride back to Natalia's house, I might have said something, but after that, I didn't say anything.
His
So it
memory
wouldn't have
is
been when you got to
back.
Tyler Rich's house?
No.
Okay. And when you got to Tyler Rich's house, you said you were just getting notifications in your pocket?
Yeah, I
And
was.
you would look at it and put it back?
Yeah.
And when you get notifications, can you read what they say if you just pick it out and pick it up and look at it?
If like my phone is unlocked, yes,
But if it's locked, what does it look like?
it just says like an iMessage notification.
And you didn't participate in that group messaging once you were at Tyler Rich's house?
No.
Now, with regards to, you were asked a little bit about where you were when you were at Tyler Rich's house after the car goes down Laurel Glen, parks down the street in your farmhouse.
Yeah.
This is just for the record. I'm showing you State Exhibit 49. Can you show us in 49 where you were?
I was over by like where like the shade is coming across the street.
So here on the left side of
Look
the
at
road
these
here.
big
Yeah.
long
So you were maybe
sentences
like
he's
one
able
house
to
up maybe,
say.
or just before the second property?
Yeah.
And would you agree with me that Farmhouse Road is somewhere down this area up here?
Yes.
Okay, so I'm directing my pen somewhere near the intersection of Farmhouse Road and Laurel Glen, at the top of 49.
All right, so noted.
And when you were in that area, you indicated you couldn't hear what was being said?
No.
And could you see people down the road?
Yes.
And you indicated that you knew Tyler Rich went down the road?
Yes.
Did you know anybody else from your friends that went down the road?
No.
But it was more than one person?
Yes.
And when Tyler Rich went down the road, how long would you say you watched what was going on down the road?
Maximum a minute.
Okay. And at some point in time, did you turn around and walk back to the house?
Yeah.
So in that minute, when you were watching what was happening down the road, you saw people talking?
Yeah.
Did you see any fighting going on down the road?
No.
Now he can see that.
When you got back to Tyler Rich's house, you said you were in the basement area, but that included in your mind the stairway?
Yeah, I was right next to the stairs.
So were you at the top of the stairs or you were at the bottom?
I'm at the bottom of the stairs, but like right at the bottom of the stairs.
And when you're at the bottom of the stairs, are there other people in the basement?
Yeah.
And what's happening in the basement?
People hanging out there.
Just hanging out. And do you recall every single person that was in the basement at that given time?
No.
Why don't you recall who was in the basement?
I just knew they were my friends.
Some of your friends included the names that we mentioned during your testimony today and yesterday?
Yeah.
At some point in time, you heard they're back.
Yeah.
And you go back outside. You're one of the first people outside?
Yes.
And when you're outside, you walk up to the defendant?
Yes.
And at some point in time, you have a conversation with the defendant, you pull the shirt off?
Yes.
How long would you say that interaction happened before you noticed Tyler Rich punch the defendant in the face?
A minute.
Okay. And
A
when
minute.
Tyler, before
That's a long
the
time.
punch, did you anticipate that there was going to be a fight, a physical fight?
No.
When the punch happens, is that when the fight starts?
Yes.
And when the fight starts, my question to you is, how soon after when that punch is thrown from Tyler Rich,
Mhm.
and you're on top of the defendant, do you feel pain in your side?
No more than 30 seconds.
No more than 30 seconds? Could it have been more? Could it have been less?
Less.
So you punch him twice and then you feel pain? And soon after you punch him, you see what motion do you see?
It's like his like fist balled up like this and just going like that repeatedly.
Before you engaged with the defendant, before he got punched, did you see if he had anything in his hands at that point in time? I have no further questions. Thank you.
Any cross?
Briefly on.
Said before Tyler Rich threw that punch, you never anticipated a fight, right?
No.
And you told us that how soon after was it when this fight broke out that you started to feel the pain? And you said that that was 30 seconds, right?
Yes.
And then the state's attorney asked you, could have been more, right?
He did say that.
And you said, no, less, right?
Yes.
And in fact, you would agree that it's always less It could never have been a longer period of time when you've been asked on a series of questions about how long something lasted, right?
I'm going to object. It's argumentative.
I'm going to sustain the objection on that. It mischaracterizes and it's argument. Thank you.
Couldn't have been any longer than 30 seconds.
No.
You told us yesterday that you didn't participate in any of that group chat, but now you've said maybe in that car ride is when you admit you sent at least one text, right?
Yeah.
And you didn't participate in that at all at Tyler Rich's house, right?
No.
You told us you didn't see anything in Mr. Valle's hands, correct? When he was standing there facing you.
I was not looking at his hands.
You reached out and you pulled the shirt off of him, you claim, correct?
Yes.
He didn't punch you at that point.
No,
He
he just
didn't-
got like super upset.
He didn't shove you at that point.
No.
He didn't touch you in any way.
No.
He didn't show you a knife.
No.
He didn't say, "Hey, I've got a knife. I'm going to cut you."
No.
And so from the time that Tyler Rich punched Mr. Valle in the face until the time that you felt the pain and got off of Mr. Valle, that was at least 30 seconds, right?
Yeah.
30 seconds, you're standing over him, punching him in the face only 2 times.
Yes.
Nobody else has joined in with you.
Not that I'm aware of. No.
Nothing further.
Nothing further, Your Honor.
Mr. Hines, you're dismissed. Thank you. Please watch your step as you exit the
Ooh,
witness.
boy.
Do that.
Thank you.
That was something else, y'all.
Say calls after Ryan Bell.
Hi, very good. Thank you.
If ever there were a punk, I believe we just saw one.
Good. Almost afternoon, Dr. Doss. How are you today?
I'm doing well, thank you.
Good. And Dr. Doss, it's a little bit difficult for everyone to hear in this courtroom. The acoustics are rough. So if you just keep your voice up as much as possible, sit as close to the microphone as you can. Okay, Dr. Doss, where are you currently employed?
St. Vincent's Medical Center in Bridgeport.
And how long have you been employed at St. Vincent's?
I think 8 years.
And is there a particular branch of medicine in which you specialize in?
Emergency medicine.
And is there a particular department that you work in at St. Vincent's Medical Center?
Just the emergency department.
And please tell members of the jury your educational background, including any degrees you hold.
I have a medical degree, of course, and a history and philosophy of science degree from undergraduate school.
And where did you attend school?
University of Washington in Seattle, and then Ross University for medical school.
And your residency was done?
Detroit Receiving Hospital.
And your work experience. Please tell the members of the jury where you've worked.
First Detroit Receiving Hospital, and then I worked in a small hospital in Georgia, and then a hospital in New Zealand for about a year. And after that, returned to this country, and I've been at St. Vincent's ever since.
And what are your duties working at St. Vincent's?
I'm one of the attendings in the emergency department, so it's seeing patients that are presenting there and managing the physician's assistants who also work in the emergency department.
How many attendings are in the ER at St. Vincent's approximately?
At a given time, there would be 3 or 4. In total, I think it's going to be maybe 12 employed there, probably more, but I'm not good at keeping track of that.
So any given time on a night that you're working, there's about 3 or 4 of you attending?
Yes.
And have you ever testified in court before today?
No.
Do you have any teaching responsibilities?
Yes, we teach the internal medicine residents that rotate through the emergency department, so they get work experience there, and medical students from Quinnipiac that come in too.
You had also mentioned physician's assistants.
Mhm.
Do you supervise them or oversee them?
Yes.
And please explain in that capacity.
So they are employed there as fairly independent providers. They see patients on their own, but also work directly with the attendings and what we call staff patients with the attendings, meaning if they describe to the attending what's going on and make sure the plan is appropriate and do some of the procedures to take some of the workload off of the attendings, like laceration repairs and things.
What would determine whether or not you do a procedure or a physician's assistant does a procedure?
A variety of things. Generally, how critical is the situation, how potentially dangerous is the procedure, and for things that are immediately life-threatening, intubations, meaning taking over someone's breathing and such, is generally something the attending would do.
And back of May of 2022, did you work at the emergency room department at St. Vincent's Medical Center?
Yes.
And on any given day or night, how many patients did you see?
Typically about 16 to 20 per shift.
And that was you personally?
Yes.
Directing your attention specifically to Sunday, May 15th of 2022, do you recall working in the ER at St. Vincent's Medical Center?
Yes.
And did there come a time when you examined a patient by the name of Ryan Hines?
Yes.
And did you have an opportunity to review Ryan Hines' medical records before coming to court today?
Yes.
May I approach counsel, Your Honor?
I hope he was more forthcoming to the medical professional than he was in this courtroom.
I'll show you with smart to state 93 for ID purposes. Please look at these documents. Do you recognize that document?
Yes.
And what do you recognize that document as?
The medical record for Ryan Hines.
And is it in the regular course of St. Vincent's Medical Center to prepare such a document such as the one you see present here?
Yes.
And is it the regular course of business for nurses and doctors to maintain such records at St. Vincent's Medical Center?
Yes.
And is it procedure for doctors and nurses to record such things on such a document accurately at or around the time that a patient is seen?
Yes.
And is this documentation certified?
Yes.
I would ask this to be marked as a full exhibit.
Attorney Smith, any objection?
No objection, Madam.
All right, court will go ahead and accept into evidence as full states 93.
Dr. Doss, handing you back now with a full exhibit, page 93, do those references if you need to.
Thank you.
Now, Dr. Doss, to your recollection, or if you can look at state 93, what time was Ryan Hines brought into St. Vincent's Medical Center on that day or morning?
Let me just double check the time. Was this, 12:24 a.m.
And where was he brought upon his arrival?
Directly to the emergency department in one of what we call the trauma rooms, which are a larger room in the front for with more space and more equipment for major injuries.
How many trauma rooms at St. Vincent's Hospital Center?
2.
And can you explain to members of the jury what indicates whether or not someone comes in as a trauma level, or what makes someone come in as a trauma level?
Right. There are some standard criteria that we go by that are primarily based on the mechanism of the injury, the type of injury the patient has, or how much force was involved, and also the condition of the patient. So if they are unstable or confused, and in this case, it was the penetrating wound to the chest that made him a trauma.
So the mere fact that Ryan Hines came in with a penetrating wound to the chest indicates that he was labeled as a trauma level.
Yes.
And how is trauma level different than triage level?
A triage level is a general concept of how potentially sick someone might be that goes all the way from triage level 1, which is the most potentially deadly situation, and a triage level 5, which is something that is not concerning at all. And that is something that is determined by a nurse out front in triage based on vital signs and complaint, and helps organize who should be brought into the emergency department first and be seen before someone else who has likely a less serious condition. And so it's related, but the trauma criteria are specifically for injuries. And when someone is brought in as a particular trauma level 1 or 2, that automatically triggers the arrival of the trauma surgeons and different staff members to help stabilize the situation.
Now, to your knowledge, how was Ryan Hines brought to the hospital?
By ambulance.
And explain to members of the jury, do you get indication from EMS when a patient's being brought in? Is there an alert system that's put into effect?
Yes, they don't necessarily call ahead about every patient, but for potentially serious conditions, they will call ahead on the radio. We get a heads up that they're arriving. They give us a brief description of the situation so that we can prepare.
And can you please explain to members of the jury how the patient, Mr. Hines, presented upon his arrival?
He presented, brought in by ambulance. He was awake and alert, but uncomfortable. And they had called ahead saying that he had a penetrating wound to the left chest and left leg.
So you knew at that point how many wounds there were?
We knew of at least 2, I think 3 wounds. I think it was the chest and flank and leg. Yes, we knew it.
And do you recall where you specifically observed those wounds?
I observed them in the trauma room upon the patient's arrival.
And prior to that morning, had you had occasion to tend to patients who had suffered from stab wounds?
Yes.
And based on your training experience, were Ryan Hines' injuries consistent with stab wounds?
Yes.
Did you observe withdrawn? Did you base your conclusions on self-reporting, or did you base that on your own personal observations, or both?
My own personal observations.
Did Mr. Hines indicate to you, or do you recall if he indicated that he had been stabbed prior to?
We had been informed ahead of time by EMS that he had. I don't actually recall if I directly asked him that question.
But you had knowledge that he was.
Yes.
Were you aware of the apparatus or what was used to stab him?
I did not know the details of the implement. We were told it was a knife, but I didn't know anything about the size or length of the knife.
Prior to you seeing a patient, is it typical for the nurses to have contact or make contact with the patient?
Depending on the situation. In this case, everyone kind of met the patient at the same time, but oftentimes the nurses do initially evaluate the patient before the doctors do.
And why in this situation was it everyone hands on deck when the patient came immediately versus the patient going with the nurses, getting assessed? Explain why that was done in this case.
Because for this type of injury, our concern is that it may be immediately life-threatening and we need to intervene right away.
Can you direct your attention to States 93, page 5 of States 93, the last line of that page. If you can just please indicate to members of the jury what it says.
Let's see, is it this, the CT report on page 5 here? Or is this the CT of the abdomen pelvis with IV contrast?
Yes, so it indicates CT of the abdomen, pelvis with, okay. If you could read the last line of that.
Clinical data, trauma 1, stabbed chest and flank pain.
What is flank pain?
The flank is the side of your body below your ribs, essentially. It's the side of your abdomen.
And directing your attention still to that same exhibit, page 7, towards the bottom of that exhibit, what does it say under CT head without contrast, final results?
It says, number 1, no acute post-traumatic intracranial abnormality. And number 2, undisplaced fractures of both nasal bones.
Number 2, undisplaced fractures of both nasal bones. What is that in layman's terms?
It means he had a broken nose.
Broken nose?
Mhm.
And had you read about this information or known about this information prior to Ryan Hines' arrival at the hospital?
No.
Directing your attention to page 12 of Stage 93, towards the mid to bottom portion of that page where your notes begin.
Mhm.
Is that your electronic signature that appears there?
Yes.
Indicated there, it also indicates it was signed, and it also indicates filed. Is that the time that you had seen him? Was this 205, or is that just? the time
That's
you signed
when the document was filed in the system. The date of service is when he was seen.
it? I'm looking at Stage 93, page 12. What does the acronym HPI refer to?
History of present illness.
And if you can please refer, Sean, in reference to HPI, what does it indicate you did?
And I'm sorry, could you said,
Sure.
yeah.
Directing your attention onto page 13 of Stage 93.
Mhm.
It indicates the continuation of the history of present illness.
Right.
You can please indicate what the chief complaint was, and then what was presented.
Right. So the chief complaint here, stab wound to the left chest, left flank, and left thigh. And in the remaining history, I'm describing any medical conditions the patient has. A 16-year-old male with no chronic medical conditions, describing the situation that led to their arrival in the emergency department. Would you like me to read it? Or?
Yes.
Okay. This 16-year-old male with no chronic medical conditions who presents to the emergency department after being involved in an altercation, which resulted in a stab wound to the left lateral chest wall, left flank, and left thigh. He also suffered an abrasion to the superior scalp and head injury, likely from being kicked. The patient was at an event this evening, did ingest some alcohol but no illicit substances, got into an altercation with someone who left and returned with a knife, resulting in this further altercation. The patient is complaining of pain at the site of the stab wounds and some worsening difficulty breathing pre-hospital. He has been oxygenating well on room air, and he was getting enough oxygen. He has had no evidence of tension pneumothorax per EMS. However, they do note decreased or absent breath sounds on the left. The patient has been hemodynamically stable pre-hospital.
Are these all of your notes that you took?
Yes.
And taking you back through that paragraph, chief complaint, stab wound to the left chest, left flank, left thigh. If you can just demonstrate on your body where those areas would be,
So
members of the jury.
the left chest here, where the ribs are, and the left flank below the area of the ribs, and the left thigh here in the upper leg.
The record reflect your notes, the witness is identifying stab wounds by pointing to his own body on his left chest, his left flank area, and as well as his left thigh.
Court will identify that the witness has identified by using physical motions on the stand as so stated.
Dr. Doss, stab wound to the left lateral chest wall. Is that the same thing as the left chest?
Yes.
Okay. And when you say chest wall, what does that mean?
We're just referring to the external surface of the chest here, and the left lateral, the lateral aspect is kind of the side. You just have to have a fancy term for everything. So that's just referring to the stab wound in the chest wall on the left side of his body.
Abrasion to the superior scalp and head injury likely from being kicked. How did you determine that?
This was to tell you the truth, I can't recall how we determined that. This is generally from information we're obtaining from EMS and the patient, but I don't recall exactly who told me about the kick to the head.
So an abrasion, what is that?
A scratch.
Is it something that's deeper than a paper cut, for instance?
No, it's probably about the same depth. Generally, when we're talking about abrasions, thinking more, not such a simple little linear scratch, but kind of when a larger area of the skin is damaged and abraded, we call it just scraped.
Could it produce bleeding?
Yes.
And so you're saying likely being kicked, that could have been self-reporting, or like you said, from EMS?
Yes.
Where it indicates pain at the site of the stab wounds. Is that something that Ryan Hines would have indicated that you would ask in his pain level, for instance?
Yes.
And worsening difficulty breathing pre-hospital. Explain that.
So this is a combination of information from the patient and EMS, basically describing that he was feeling that he was getting more short of breath. He was having more difficulty breathing as time passed in the time period it took to get to the hospital.
Would that be typical of a wound to the chest wall?
It can be. It depends on really how bad the wound is and what the situation is.
Could you have a wound to the chest wall that would not penetrate a lung?
Oh, absolutely. Obviously, the ribs are protecting the area, and the whatever object does not penetrate through past the ribs into the lung, which can happen.
Being that the patient was complaining or indicating that he wasn't breathing very well, did that indicate to you that there was a possibility that his lung had been punctured?
Yes.
Back to Stage 93, page 13, that same paragraph. No evidence of tension.
Pneumothorax.
Pneumothorax, thank you, for EMS. What is that terminology, pneumothorax?
So pneumothorax is just the fancy term for air in the chest wall outside of the lung and causing the lung to collapse. Tension pneumothorax is a specific type of that, which because of, not to get too far into the weeds, a one-way valve of a kind of, the pressure continues to increase inside the chest. The air can enter but not exit through that wound, and the lung is pushed further and further, and then ultimately, other structures in the neck and chest are pushed to the point where the heart cannot beat properly and people can die very quickly.
They do note decreased or absent breath sounds on the left. This patient has been hemodynamically stable pre-hospital. What does that sentence
That means that hemodynamically stable is just referring to things like his blood pressure and his heart rate. We're watching those to make sure that there isn't any sign of that kind of compromise to the function of the heart or the circulatory system, which we would see if his blood pressure were dropping and likely his heart rate is increasing to try to compensate. That was not, those kind of dynamic changes were not happening on the way to the hospital.
Directing your attention to that same exhibit, Stage 93, about mid-page on page 14, where it says pulmonary, chest, abdominal, and musculoskeletal.
Mhm.
Under pulmonary, where it indicates absent breath sounds, diminished breath sounds, right upper lung fields. Was that When you saw that, was that concerning to you at all, and why?
Yes, specifically the absent breath sounds on the left would be concerning in this context because that would make us worried that he had suffered an injury to his lung and that had collapsed and was not functioning properly. The diminished breath sounds in the right upper lung field are relatively non-specific, just meaning that we're not hearing quite as well in this area, so we need to make sure that that's okay as well.
And you had indicated earlier that a certain condition can occur if left unattended. Can you explain what that condition is and why that would be something that would be life-threatening?
The tension pneumothorax,
Yes.
specifically, yes. So that would be kind of this steadily increasing pressure within the chest cavity that is starting to push everything over to the opposite side and lead to a situation where the return of blood to the heart is impaired, and now the heart's not able to continue circulating blood, and this would result in death.
Okay, that's obviously a very serious situation.
Yes.
And if Ryan Hines had been left unattended, not brought to the hospital to tend to that, is that something that could have caused death?
Yes.
Directing your attention to page 14 as well, on SACE 93, where it says stab wound under abdominal, stab wound left lateral flank, musculoskeletal stab wound left lateral thigh, left lateral flank and left lateral thigh. Anything about those wounds that were concerning to you regarding any arteries that were around that area or anything of the sort?
Right. I think we always get concerned with an abdominal or flank wound because, of course, there are many important organs in there that if they're directly injured, you can have quite a lot of internal bleeding quickly with the spleen, the kidney on that side. And with the wound in the thigh, we have to, consider, of course, injury to a major blood vessel and bleeding from that. The location on the thigh was a little less concerning for that kind of problem.
Directing your attention to the bottom of page 14 on SACE 93, where it says MDM, clinical impression notes. What does MDM, the acronym, refer to?
Which is medical decision making. It's a section to describe what we were thinking and what we did.
And where it indicates in that paragraph, it says portable chest x-ray confirms left side pneumothorax, no evidence of hemothorax. What does that sentence refer to?
So that it says that when we took an x-ray of his chest, this is in the trauma room still, he's in the stretcher, we're taking a film right there, we can see that that left lung has collapsed. We do not see evidence of fluid filling the chest cavity, which in this context, we'd be worried about blood filling up his chest. That was not the case.
On an x-ray, what would you see to indicate that the lung had collapsed, for instance?
You can see for an inflated lung, the lung markings there and the absence of them. And often you can, in the case of a pneumothorax, often you can see kind of the border of the lung as well. So you can see how much it has collapsed.
Could you see on an x-ray any kind of penetrating wound, like a laceration or anything that would have caused that lung to collapse?
You can see secondary findings of it. It's not a study that's going to show the soft tissues like that, but you can see things like swelling in the air. You can see some air tract entering the chest wall, that type of thing. So you see secondary findings of it.
It indicates also on page 14 of 93, a chest tube is in place for the trauma service and further trauma workup is pending. What was the purpose of that chest tube?
That is a device that's placed into the chest to suction essentially the air out of the chest cavity, allow that lung to reinflate. And if there were blood in the chest cavity, it would also be draining that fluid out of it.
Directing your attention to page 15 of SACE 93, at the top of that page, patient will be admitted in the trauma service for further care. What was the purpose of that?
The initial period of time after placing that chest tube, although, of course, a good thing that the lung is reinflating, that needs time to heal somewhat before the chest tube is removed, which would typically take place in the hospital before the patient is sent home. So they need time to make sure the lung is inflating again and staying that way, and remove the chest tube and ensure the lung doesn't collapse again once it's removed.
Page 15 of SACE 93 under critical care indicates the patient was critically ill with a high probability of imminent or life-threatening deterioration. That notation, does that reference what you described before regarding the, I'm going to say the word wrong, but the tension that you were describing, which could have caused death?
Well, not only that, but even without the tension pneumothorax component, this can be a deadly injury. And so this is a situation where until the patient was stabilized, the likelihood of him dying was relatively high.
Now, I'm going to be showing you some photographs that have already been marked as evidence. Showing you what's been marked as SACE 84. Did you see that on your screen?
Yes.
Okay. What would you describe that as?
This is the abrasion to the scalp, as mentioned.
And showing you SACE 83.
All right.
Specifically towards the hairline there.
Right.
Same abrasion that you're describing.
Yes, it is.
And showing you what's been marked as SACE 85. Are you able to identify what this is and describe to the jury what the purpose of that would be?
This is that chest tube that was mentioned. There are different types of these and different sizes. This is a device that's placed in the front of the chest and a relatively smaller size, which is mainly meant to pull air out of the chest rather than fluid.
And does that go directly into the wound?
No, it goes elsewhere in the chest wall in between the ribs in a way that is designed to be at a certain angle so that when the tube is removed, that space closes on its own.
Showing you stage 86. And if this is the wrong orientation, I can certainly flip it. So are you able to see, is this the right rotation you need to do?
I think so. It's just the angle a bit. But I think this is the left side. Yes, this is the left side of the patient's chest. So in this photograph, the way we have it oriented, his head would be up at the top, off the side of the screen.
Okay. And this tube that you see pictured on stage, apologize,
Mhm.
86, is that connected to that port you just indicated?
Yes, that's the chest tube.
Okay. And this gauze here with the tape, what is
Mhm.
that over?
I think that is over the stab wound itself.
Showing you stage 87. Flip that. What is this a photograph of?
That is the photograph of the stab wound to the chest wall.
That's the wound that punctured the lung.
Yes.
And showing you stage 89. What is that a photograph of, Dr. Doss?
And that's the stab wound to the left flank.
Left flank.
Mhm.
And showing you stage 91. What is that a photograph of?
That's the stab wound to the left thigh.
Okay, and that's obviously a different stab wound than the left flank stab wound you just indicated.
Yes.
And finally, stage 92. Do you agree that these are photographs of all the puncture wounds that Ryan Hines suffered?
Yes.
And the one at the top of stage 92,
Mhm.
This would be the left flank.
Oh, no, that's the left lateral chest. And the left flank is the one below that.
Thank you for correcting me.
No problem.
Left flank is the one below, mid exhibit, and then the last stab wound is to the, what did you refer to that as?
The thigh.
Thigh. Thank you. Directing your attention back to stage 93, page 20, where it says underneath H&P encounter notes. What does that mean, H&P encounter notes?
So this is the history and physical that's written by the trauma service. And encounter notes is just a general term for notes we took regarding this encounter with the patient.
And that was a physician's assistant that took those notes, that you can see.
Yes, it looks like it was Matei Manea.
Where it indicates a 16M, is that 16-year-old male?
Yes.
Okay, stabbed in left chest, mid-axon with about a 4/5 intercostal, left flank, left lateral hip. What does that mean?
So he's describing the location of these stab wounds. That left chest mid-axil line is an abbreviation for mid-axillary line. And the axilla is the armpit, so the middle of the armpit base of the line drawn from the armpit down. And then the other two stab wounds.
Hemodynamically stable with mild tachycardia, left pneumothorax without significant hemo. What does that mean?
He's abbreviating hemothorax there. So he's saying there is the collapse of the lung on the left without blood collected in the chest wall. And the hemodynamically stable means his blood pressure has been steady, but his heart rate is fast, probably compensating for the injuries.
Is it safe to say that the physician's assistant also tended to the wounds of Mr. Hines? So where it says place a 14 French pigtail cath anterior second intercostal space, what does that mean?
So that's this chest tube. When they say pigtail catheter, it's a kind of catheter that is built to twist in there, so it's not directly puncturing anything else. And this is describing where that was placed. It was the anterior, the front of the chest, and the second intercostal space, and they're just counting down the second rib and that space in below the rib.
Is that what we saw in the photographs that were just depicted?
Yes.
And adequate re-expansion of the lung, mild air leak. Is that something that repairs on its own?
Yes, they monitor that. When this chest tube is hooked up, it's connected to a kind of suction device, and they're monitoring that pressure over time, and that air leak typically would get better as the wounds do.
It also indicates washed out stab wounds small enough that will heal by secondary intention to avoid closing and having infection. What does that mean?
That means that the two wounds, the one on the flank and the thigh, well, actually, including the stab wound in the chest, they washed these out, but they did not want to suture them closed because they would worry that would increase the risk of an infection in the wound to kind of close everything up inside of there. So they let it heal by secondary intention, which is just the term for letting that kind of close on its own and heal from the inside out instead of closing the skin.
Is that pretty standard with wounds such as this, to not suture them?
Yes.
Directing your attention to page 22 of stage 93, where it indicates secondary withdrawn primary assessment and secondary assessment. What is the difference between the two of those?
These are specific to the trauma process. When patients come in after injuries like this, the primary assessment is what is immediately life-threatening happening right now. Is the patient breathing? Are they circulating blood well? Are they able to talk to us? And they're what we call protecting their airway. They can keep their airway open. And then the secondary assessment is a head-to-toe kind of protocolized examination to make sure there are no other injuries that are missed.
On page 22 of that exhibit, under primary assessment, where it indicates breathing, minimally labor with some associated
Dyspnea.
Thank you. What does that mean?
That means that his breathing was a little bit fast, a little bit difficult. He appeared to be having a little bit of a hard time breathing. That's what they say, I'm minimally labored. And dyspnea is the subjective sensation of shortness of breath. When someone feels short of breath, that's called dyspnea.
I want to know what his blood alcohol was.
After the chest tube is placed, that can resolve pretty quickly, but without that, it would last for a while. If the patient survives, it would be a process of healing that would take some time, days probably.
Do you know how long Mr. Hine was kept in the hospital for?
2 nights, and then actually, I wasn't sure if it was 1 night or 2 nights. I think it's 2 nights though. Ultimately,
What was the purpose of keeping him for so long?
that is to monitor the effectiveness of the chest tube and make sure that air leak resolves. That once that wound starts kind of closing on its own and there's no longer the passage to allow air out of the chest or into the chest cavity, then they can safely remove the chest tube. So it's really that period of time to monitor and make sure things are not getting worse and that they're getting better.
Under where's the secondary assessment on page 22 of states 93, it does indicate nose and it says no injury.
Mhm.
That was a little surprising to me, as you had indicated that he did suffer some broken nose. Why does it say no injury there?
I think this is fairly common in a situation like this where that was not their primary focus, and so that can be missed. It may have been the case. I think looking back at the photographs, his nose was not visibly injured that badly, so it wasn't something that was focused on, and it may not have been particularly tender when they felt the area, so they didn't appreciate looking at the nose that it looked injured, and then we saw in the CAT scan that he did have a broken
That
nose.
indeed was. States 93 on page 64 of that exhibit. Do you see any indication on this page of the patient if the patient's blood was tested for alcohol?
Yes, let's see. Yes, I do see that.
Okay. And what does it indicate?
That the result of that test was a value of 7 milligrams per deciliter.
What does that mean in BAC terms and what alcohol?
Right.
If you can convert that.
For the state of Connecticut, I think the legal limit of driving is if you blow a 0.08 on the breathalyzer, that would be an 80 on this measurement. So 80. So this is like a 0.007 or something.
0.007.
Right. Yes.
Now, based on your expertise with the fact that Ryan Hines had a 0.007 BAC level, would that have affected his injuries, the way he was treated anyway?
No, I mean, it would really just indicate that he had something to drink earlier in the night, but this was not a level of alcohol that would have caused his injuries to be more complicated or caused him to really be intoxicated. Clinically, we say, like not, visibly intoxicated, that kind of thing.
Maybe he was
Thank you,
telling the
Dr.
truth
Dr.
about that. Who knew?
Attorney Kamara.
Everything else was
Nothing
such a
else.
mess.
I got news.
We've never met before. Correct.
Yes, correct.
So I'm just going to ask you a brief series of questions. You said as far as the nose, no injury. That could have been because it didn't appear to be visibly injured. Correct.
Yes, correct.
Sorry, but the head nods aren't caught by the court
Right.
reporter. Have you ever testified before in court?
No.
Oh, okay. So the court reporter here has got to hear a yes or a no. So if you just do that for us.
Got it. Yes.
And you said the patient himself wasn't complaining of pain to the nose.
Not that I recall.
And then you said, and so then there was a CAT scan that was done, and that reflected that there was a, correct me if I'm wrong, non-displaced fracture, correct?
Correct.
Did that give you any indication of the age of that non-displaced fracture?
We can generally tell on imaging if the fracture is what we call acute, meaning this just happened or not, because healing starts pretty quickly. So
Okay.
this was an acute injury that just occurred.
Gotcha. And the description in the notes that you were looking at said that superior scalp and head injury likely from being kicked, correct?
Correct.
That's based on self-report?
I suppose, I'm afraid I don't recall where that information came from. So I cannot speak to whether it was accurate or not. I think it was secondhand information. Of course, for me, it would have been secondhand information. But I don't know who told us that.
And that the patient did admit to some alcohol use, correct?
Yes.
And that was confirmed by the results of the toxicology, correct?
Yes.
And that he also denied any illicit substances, correct?
Correct.
But that, however, was not confirmed by the toxicology because that did reflect on page 11 positive for cannabinoid, correct?
Let me take a look.
That's why he wasn't drinking.
Yes. That's the result is positive.
He was
It doesn't
smoking.
necessarily speak to when the cannabis was used.
Right.
Oh.
And so you told us today what you did as far as treating him for his wounds,
Mhm.
correct?
Yes.
But you couldn't tell us or help this jury if what they wanted to know was why what had happened to him that evening, correct?
Correct.
Thank you. Nothing further.
Any address? All right, thank you. You're dismissed from the witness stand. Thank you. Please watch your step as you exit. All right, at this point in time, I would direct the state to call its next witness.
Okay. We're getting close to the end of the day here, folks. We've had a full one again today. I am going to get things set up for us for tomorrow. But I feel like today was very enlightening. I feel like we learned a lot. We saw several witnesses that can't answer the defense's questions. They're incapable. I don't recall. Sure, that was another one. So we saw Ryan Hines, Tommy Connery. Oh my goodness. Faison Teal. We loved Faison Teal until he was cross-examined, and then it all went hellward. And I think we had Ricky today too, Tricky Ricky. Tomorrow, I would think we should be narrowing it down to the individuals that were inside the vehicle with Jack, Raul, and Tyler. I'm not exactly sure what the order is, but I would think Mackenzie Trafficante is going to be one of the individuals we'll be seeing shortly as well that will come and testify. We are probably, I would say, about halfway through day 5. And so we'll have the rest of day 5, and I think we'll get through day 6 and 7. Oh, and maybe even 8 tomorrow. We'll have to see, because one of those days I know is short. I think it's day 6 that's short. So please, if you're on the replay crew, I thank you very, very much for coming on and watching this replay of the Raul Valle trial. And if you've hung out with me all day today, thank you so much for hanging out with me all day. Make sure you do the YouTube things, like, subscribe, comment, do all those things that you need to do. And if you're on the Twix, you might want to pop over to the YouTubes or the tubes of you, however you want to say it, and do a quick like or subscribe or both, and hit the notify button so you know when I go live again. And we'll plan on being back here again tomorrow morning at 8 a.m. Central Time, 9 a.m. Eastern Time. And I see that I had a lot of people on the West Coast this morning, so it'll be 6 a.m. for you folks. I'm so sorry that's so early, but we'll be back here tomorrow to continue on with the testimony in this case. And remember, I always tell you, it doesn't cost a penny to be kind. So find someone to do something nice for today if you haven't already. And as always,